for operation and maintenance. But in many schools where the head teachers are creative, they look for other ways like fundraising, like conducting a charity walk, so that they are able to get extra monies that can help them to repair some of these facilities. Number 4, an effective strategy for menstrual hygiene management. It requires that both boys and girls at an early age are made aware of menstruation. This will help us in fighting dropout of learners from schools. Number 5 is partner commitment is critical in the implementation. Sometimes the partners promise funds and funds never come. Sometimes they stop funding along the way, and then we are not able to benefit from these projects. The other lesson is that provision of infrastructure without behavior change is a waste of resources. Yesterday, many participants here were sharing stories of how some communities burned plastic tanks, they pierce plastic tanks, they break into the school latrines because they want to ease themselves, but the school administration has decided to lock the latrine, so the only option they have is to break so that they ease themselves. They have no access to the water in the school, so because the taps are locked, so when they manage to go inside there, what they do is to break them. So we need to address the issue of behavior change. The other lesson was the private sector engagement is central in the provision of wash facilities. Recently, Mr. Birungi worked with, I think, Rotarians here, and we were able to collect soap for Karamoja. So the private sector is very critical because sometimes they have the resources which we don't tap into. So they can always supplement government efforts. But more importantly, for this private sector to thrive, the government needs to put into place an enabling environment where they are able to work and provide these services. In terms of monitoring, we learned that if we don't monitor, we can't improve. You cannot improve what you have not seen. You need to see something, assess the status, and then you can plan for improvement. The 3-star monitoring is key to wash improvement. All of us are familiar with the 3-star model. It was also observed that lack of financing for monitoring impacts on the quality of data. We needed data to be able to make objective decisions, to be able to allocate resources where they are needed the most based on data. We also need now to address the issue of climate. We have to be resilient when it comes to issues of climate because now this is a global concern. That's why we are now talking about tree planting, greening schools, because this is critical when we are talking about wash. Last but not least, environmental protection. My brother Mukwana is here. We have now developed Engineer Mukwana standard for recognition. Yes, Engineer Mukwana came up with a design of lined pit latrines. And I think this is the way to go. Lined pit latrines that can be emptied and used over a longer period of time. Instead of the current system we are using, you dig a pit, when it is full, you abandon it, dig another one. When it is full, we abandon it. And for example, in Kampala, where we have limited space, you end up even failing where to locate space for a pit latrine. So, one, it ensures longevity, but more importantly, it also minimizes contamination. So, ladies and gentlemen, thank you for your kind attention. I welcome questions, if any. Because I have a strong team here to respond to these questions.
I think you have convinced them. Anybody has a question? Okay, thank you very much. Can we please have a round of applause? Thank you so much. You're getting tired, but the tea is almost here. I don't know what is happening. Please clap so that we can get our tea. Yeah, thank you so much. Now we have 10 minutes to our tea break, and I would like to invite just one presentation to use just those 10 minutes. You're not going to go beyond that. The next presentation, is that the one? Okay. So as the next presenter is coming, allow me, ladies and gentlemen, to make some few announcements. Please allow me recognize the presence of our members of parliament amidst us. We have Honorable Etuka Isaac Joakino, MP Upper Madi County. You're very, very welcome. There is Honorable Sebikali Joel, MP Ntwetwe. We are glad to have you, sir. And then we have Honorable Komal Joseph Midi, MP Dodoth North. You're very, very welcome. Thank you so much for joining us in this deliberation. We hope that you will continue doing this with us. Another very small announcement. The people who are coming in, please, as you're registering, they request you to register on 2 forms. It is to help us account to the people who have supported us to have this. So please do that. That is from the ushers there, so that we are able to have our meals, but also register our presence here. Thank you so much. Can I now invite Minister of Education to take us through some highlights from the school health policy. The presenter who is going to be taking us through highlights from the school health policy. Are you here? Please bear with us. This is going to happen in the next few minutes, 10, and then we shall be off.
Good morning, ladies and gentlemen. I'm called Muhammad Kasule. I work with the Ministry of Education and Sports under the LSHIV unit of the ministry, which is coordinated by, which is under the docket of basic education. With sort of relevant to share with you the highlights of the policy, because what we are talking about, WASH, is somehow anchored into this policy. Just to inform members that the policy now is heading to cabinet. Of course, some members are aware that the policy has been in our shelves for some time, but just to inform you that at least now where we have reached, we shall be able to see the light of the day. our policy and research analysts are working on the cabinet paper, which will be shared soon to the cabinet. But just to inform you that let us hope that when the year ends, we shall be able to see the policy approved. Of course, it's a bigger policy, but I'm going to pick out key areas for our emphasis. In terms of the structure, the policy is structured in the way that we look at the introduction, the policy and legal framework, the problem statement, the justification of the policy, direction, strategies, financing, implementation, framework, monitoring, evaluation, and review. So a quick snapshot on the background. Of course, as you know, that the vision of the sector is to achieve equitable access to relevant and quality education, training that enhances efficiency and effectiveness at all levels for all learners. But of course, in order to achieve this vision, the health of the learners needs to be protected to ensure optimum school attendance and learning. So issues of school health are indispensable tool to achieve both quality education and access to health for all. So for us to ensure that our learners are able to perform very well, we need to ensure their health status is protected. Because if they are sick, they won't perform very well. We shall have a bigger number of absenteeism and school dropout. So health issues really are very important in achieving the quality of education. So in terms of the background, I won't brag so much. Of course, according to WHO expert committee, comprehensive school health education and promotion health programs can increase the efficiency of education system. Of course, the government has been delivering health services in schools. There has been no existing national school health policy to provide that overarching guidance, and that's why the ministry came up with this policy to ensure it provides that overarching guidance of all partners that are really implementing school health, including the WASH programs. So a number of initiatives have been in place which the ministry has been implementing, and I'm happy that some of these interventions I've already talked about: the WASH program, life skills, menstrual hygiene campaigns and management, preventive and curative health programs such as the deworming, vitamin A supplementation and immunization, which work conjointly with the Ministry of Health to do this. But you find that all these interventions, they don't have that kind of a policy to give direction. In terms of the problem statement, just to inform you that members that virus health challenges are comprehensively analyzed and presented in the RIA report. Before coming up with the policy, the ministry through the policy analyst department came up with the RIA. RIA means the regulatory impact assessment that gives a snapshot of situation on the ground that justifies for us to come up with a policy. So within this RIA, it identified so many issues. One of them was the prevalence of communicable diseases in education institutions, including HIV, tuberculosis, malaria, among others. Then the other issue that was identified in the RIA was lack of capacity and readiness among the education institutions to ably manage and mitigate the control pandemics. I know yesterday talked about COVID-19, the Ebola, etc. Then also prevalence of high rates of teenage pregnancies, poor sanitation and hygiene in schools. So all these were identified by the RIA that gave a justification the ministry to come up with a national school health policy. Of course, also another issue, we have an inappropriate transport means. Fire outbreaks is another issue which was identified. Rates of alcohol and substance abuse in and around schools. Prevalence of rates of violence against children, and prevalence of stigma and discrimination among the learners, especially those who are living with HIV. So in terms of the justification of the policy, one, the policy is coming into play to streamline the virus health interventions in a concurrent and elaborate framework. Then the other one need to put in place a deliberate set of guidelines and standards for all stakeholders to adhere in handling LSA status. In fact, one of the guidelines are the WASH guidelines. I'm happy to inform you that under the basic education, those guidelines already are in place. Then the policy is required to provide that framework through which the different stakeholders can undertake interventions aimed at solving the LSA challenge in schools. Then in terms of the policy direction, of course the policy has a vision, a mission. So in terms of the theme, of course also they have a theme. A theme, LSA mind in a LSA body for better education outcome. Of course, when our minds are LSA and the body is LSA, the output will be we shall have a better education outcome. Then the vision of this policy is the LSA school community for better education outcomes and national development. Then the mission is to guide and design implementation of sustainable, effective, and quality LSA promotion initiatives in all schools and education institutions in Uganda. Then the goal, lastly, is to enhance the quality of LSA in schools and surrounding communities in order to promote education for all. That's the key goal for the policy. So in terms of objectives, the policy has 5 objectives. One is promote universal and equitable access to curative and management services of the different LSA-related complications and challenges. Then the other one is to design and implement a skill-based LSA education and promotion programs for education stakeholders. Then formulate and implement appropriate preventive services. Then the fourth one is to design and implement and promote services aimed at identifying, managing, and rehabilitating learners with special needs, stakeholders in need of these services. Then lastly is enhance sectoral coordination and resource mobilization for provision of quality and sustainable LSA interventions in schools. So those are the key 5 objectives. But within those 5 objectives, we have got critical interventions that in case the policies have been approved that we envisage to implement. But I'll quickly go through this. But before that, the policy has the guiding principles. One of it is gender equity, collaboration and partnership. And that's why we are here, because that's why we emphasize we need to work with our key partners. And needs-driven programming, we base on research and evidence-based to really come up with interventions. Then the other one, then the youth response LSA services, increase access to LSA information for school communities. So in terms of the target, the policy has target. It targets 3 key stakeholders. One, the beneficiaries. These are the learners from the different institutions, primary, secondary, TVET, and teacher training institutions. So the policy targets all those key stakeholders. Then under school communities, it includes the parents, the guardians, the school management committees, the board of governors. Then lastly, the policy makers and the implementers, the members of parliament, because of the role to play to ensure this policy is effectively implemented, the ministers. So one of the key objectives, because as I said that there are 5 objectives in this policy, but among those objectives we have got interventions. I'll take you through this. We have promote universal and equitable access to curative and management of services for better, for the virus the secondary government. They have deployed actual school nurses to support on the medical treatment of the learners who have got LSA issues. So the other one, among those interventions, I know there are so many, but I will allow me to pick 1 or 2. So design and implement initiatives aimed at promoting knowledge, information among learners and other education stakeholders about the virus virus disease and health conditions. We're talking about COVID-19. All schools are aware how to manage and mitigate COVID-19, and this is what the policy is really proposing. Then the other intervention is to design, implement skills-based health education and promotional programs. One of the key interventions, which is anchored on what we are looking at today, is to design and promote safe, affordable, and student-led menstrual health management initiatives in all education institutions. This is one of the key intervention that the policy is looking at. Then also the other one, promote nutrition and parental-led school feeding programs in education institutions. Yeah. Then another key objective where we are looking at is to formulate and implement appropriate preventive services. So under the key interventions here is to implement initiatives aimed at establishing and promoting safe, clean, and conducive environment in and around education institutions, which is free from vectors and other disease-carrying organisms, harmful physical objects, and hidden bushes. And that's where issues of sanitation really come in. Then the other, I'm sorry to take you through because of the time, because I have 10 minutes. Then the other objective is to design and implement promotive services. So under this, key intervention is to design and implement interventions aimed at rehabilitating and reintegrating learners with health challenges such as mental disorders, HIV, among others. As you are aware, as a sector, we are concerned our learners committing suicide. So one of the key interventions is to ensure we support, we provide guidance, we rehabilitate these learners. Then the other one is to enhance our sectoral. Before that, I think I jumped a very important where we have the wash. It is, I think, formulate. Can go back to formulate. Yes. Formulate, they will have objective, I think, key intervention number 6. Yes, yeah, design and implement initiatives aimed at ensuring availability and promoting access to safe and water, sanitation, and hygiene facilities among all education institutions. These are another critical interventions on what we are discussing now in this symposium. So it's under that objective of formulate and implement appropriate preventive services. Lastly is about the issue concerning the policy implementation. Ministry of Education and Sports, in collaboration with the Ministry of Health, shall take lead in the implementation and coordination of this national school health policy. Colleagues, as you are aware that we play our sectoral role. As a sector, for us, our role is to ensure young people are equipped with the information and skills. Then Ministry of Health comes in to give that package of the treatment and service to the learners in schools. In terms of the finance, the government will finance the implementation of the National School Health Policy. Our policy and research department came up with what we call that strategic plan for this policy. And the proposed cost for the 5-year is 77 billion to ensure this policy is effectively implemented. That's what our policy analyst came up with a plan that gives us that kind of a status of what the costing status of what to implement this policy. So in terms of monitoring and evaluation, school health cuts across the development sectors and levels. Assessment of progress, outcomes, and impact of intervention to address the health is a shared responsibility of all development actors. So that's one of the key area under monitoring. The policy shall be jointly implemented between all key stakeholders, especially Ministry of what? Health. The ministry will be responsible for coordinating M&E for the National School Health Policy within the overall monitoring and evaluation framework for integrating school health performance and monitoring indicators into our education management information system and ensuring the quality reporting. Lastly, members, I thank you so much for listening.
Thank you. Thank you so much for that presentation. It gives us a framework in which to operate and to put all our initiatives that we are thinking about. The big question is that budget thing which was at the end there, the 77 million and how we are really going to manage to work through that. Fortunately, the MPs are around and also other partners. So this thing here we will manage. We are going to manage that 77 million. We will have that money and actually have our policy done because we need it to be able to go further. So thank you very much. I am not going to ask you people to intervene at this point because we have that other strategy, which is the outside on the veranda. So we finish that strategy first, then we come up and come back and wrap up this and proceed. So ladies and gentlemen, you're welcome to that break. As usual, I'm again going to take the microphone to Reverend to quickly, this time it is not offers, but the tea has been sitting there, so it might cool. The prayer should be.
Okay, let us pray. Father, we thank you so much for what we have covered so far. And now as we are going for the break, we ask you to bless what is prepared for us. In Jesus' name I pray.
Thank you.
장점이 있고 기대 수명은 한 5년에서 8년 정도. 동력식막 경수장치는 물물의 압력을 통해서 그 멤브레인 표면에 있는 작은 미세한 기공들을 물 분자를 통과시키고 그리고 이런 기공보다 큰 세균 및 탁구 물질들을 걸러내는
Uganda Road.
전기 없이 개발도상국 오지에서도 사용할 수 있고요. 특별한 유지 관리 없이 장기간 사용할 수 있다는 장점이 있고 기대 수명은 한 5년에서 8년 정도. 동력식막 경수장치는 물물의 압력을 통해서
Buganda Road Primary School, Buganda Road.
표면에 있는 작은 미세한 기공들을 물 분자를 통과시키고 그리고 또 기공보다 큰
Buganda
세균
Road,
탁구
hurry up.
물질들을 걸러내는
Buganda Road Primary School. Please hurry up. And ladies and the gentlemen outside, please come in.
For my case,
Come with your tea. Let's make it a working tea.
for treatment. Yeah, that's the problem I was facing right now. So even before the purifiers were brought, we could boil water with charcoal. That money we can save. The money for charcoal we can save.
Ladies and gentlemen, we are back. Please come with your cup of tea. You're missing what is going on here. Okay, so who holds it? Ani ajikwata jo byaliwa. Muyina obuzindaalo bwammwe. Muno mu malubuuki. Mubukole nongo obuzindaalo buwulikika. Temwekomo maawo mmemme njagala akazindaalo nga keeko. Kale mwanguye. Your part, eh? Naye ayinayo part. Kati naye mukwanga omuzindaalo. Your part. Ye etandikirawo. Banyiza okukateeka wali. Kati ye bwetuuka n'akajjawo. Kinaamukaluubiriza. Temulina kyakiyo.
Hello.
Then n'alyoka aleesa. Najja. Okay, kakati mukateeke wali muleete. Kambateere wano. Mbateere wa. Eno mu maaso. You will remember to be here. Wano temukozesaawo.
expecting no one to be left behind. For those little rooms behind the school, make the grade. Prevent and prevent as much as you can.
Without proper wash, diarrhea may kill us. Haven't you heard that? Mm-hmm. Haven't you heard that? 88% of diarrhea is by poor wash.
Oh, Wangegwe, that question goes to you.
Worm infections hinder our development. Stunted we are. Worm infections. Repeating classes. Worm infections.
Eh.
How can we pass in pain and discomfort, competing for nutrients?
The body
Takes in this. The worms take in that.
An area results damage to the tissue, damage to the organs.
Poor us. Let's talk about the toilets. Those little rooms behind the which make the grade. Your faces show that you doubt. I tell you, and you doubt. Your faces may be brown, but soon they will frown. With mountains of faces on floors, poo-poo painted on walls and doors. Some learners even get guts to write on toilet walls using what you have understood. For those little rooms behind the school, make the grade.
But those washrooms, if kept clean, learners green, when we come in, we feel cool. Push the stool, then feel good, indeed very good. Toilet paper, pure and plenty, to clean the behind, spick and span, then wash hands with clean running water and soap. If not that, we sanitize, then sit in class, study without fuss. We shall pass and achieve success. For those little rooms behind the school, make the grade. Those dirty toilets smelling like pigsties would be the last thing I wish. The last thing I wish, even for my worst enemy. Millions and millions of germs creep around the unclean surfaces. Every seat, every touch on a dirty surface puts our lives at risk while at school. Save us, please. We have no contract with wash-related diseases. Typhoid, cholera, dysentery, and urinary tract infections. When we study in a dirty environment, we soon fall sick and then very ill. Hospital bills will eat school fees. Schooling will fail and the grades will vanish. For those little rooms behind the school, make the grade. In one of the lessons with our science teacher last term, she taught us how to maintain sanitation at school. She said,
Caution creates clear cuts for clearance class. Use tissue to make your behind spick and span. Is that okay?
yes, teacher.
Wash your hands after visiting the toilet. Is that okay?
Yes, teacher.
With clean running water and soap. You can never go wrong.
But the scarcity of water in the school tells that the teacher was just covering the syllabus. But if we had plentiful clean water, we wash the hands, wash the palms and the back of the palms, pick the nails, everything would be okay. For those little rooms behind the school, make the grade. There is something I can't forget. The monthly moon time for all of us, the adolescent females in schools, an obligation causing irritation. I wake up to take on my studies, and slowly, out of nowhere, I find pangs of pain creeping, mild at first, then increasing, shifting, twisting, accompanied by bleeding. I feel perplexed, my mood swinging, changing, conflicting, and contradicting.
In its presence, when it appears, some girls lack the sanitary pads.
Even when available, we change from those dirty rooms. No water, no tissue, nothing to help. The fear of staining the uniforms makes some girls to abscond class. Some girls are ridiculed, sidelined and silenced. The inquisitive and participatory student transitioned into a slow learner or failure. Please take note for those little rooms behind the school. Make the grade. Now that you know the fact that there is need to behind the school, make the grade. Paint them. Pay a worker to clean them. If not that, teach us. We clean them. Every room with a door and a shutter. A door and a shutter. For those peeping toms to fail to see. Detergents, fresheners, mops and brushes. Buy in plenty and put them to use. Parents, teachers, inspectors and other stakeholders. Let's be as cooperative as termites. For those little rooms behind the school, make the grade. You can't teach a teacher unless you are a preacher. But I'll dare to. School inspectors, wake up. Save the schools. You find a school with poor wash that you close. A school head with poor wash that you demote. A school head with good wash promote at once, because you remember those little rooms behind that school. Make the grade. I have a dream that after all this, schools will be clean, toilets clean. You enter the schools throughout Uganda, attendance regular, even for the girls. Menstruation made easy mwatu. In the whole school, no diseases, no stench, but sweet aroma, as sweet as a rose. Then I'll stand as a superhero for those little rooms behind the school. Make the grade. Sicho, bye-bye.
People, I've always said, a standing ovation for the great. Hey! Amazing! Brilliant! Good job. Well done, children. You are amazing people. You have taught us a lot. Every time these children are talking to us, I am literally tearing. I have tears in my eyes because I'm like, are we listening to what they are saying? And I am so impressed that they are a part of this, because they are the reason we are here. Now, just to conclude, while your brains are still thinking children, I said they went to the parliament, remember? And I said they will come back and tell us what they agreed on. Remember that? So they will be organizing themselves, and after our presentation that's coming, then they will come and tell us what exactly they agreed on. Ladies and gentlemen, allow us to invite Water and Life. They are our colleagues from Korea, and they really have to go back. So we don't want them to miss the flight, much as we would have wanted them to stay around and we finish this together. But please allow us to invite them, and they share with us about new wash innovation and technology. We don't want to miss that. Thank you very much.
Oh, yes, please. Okay. Okay, hello. All the members of Ministry of Education and Sports, and honorable MPs, and all the representatives from different ministries and international organizations, NGOs, private sector, students, and ladies and gentlemen. It is an honor to present Water and Life and our project here together. My name is Anna Ryu, CEO of Water and Life. We are from Korea. Today I would like to introduce you, our company, and the safe drinking water project we are planning. So before I start my presentation, let us have the short video so you will get the sense of my presentation easily. Okay, thank you.
전기 없이 개발도상국 오지에서도 사용할 수 있고요. 특별한 유지관리 없이 장기간 사용할 수 있다는 장점이 있고, 기대 수명은 한 5년에서 8년 정도. 중력식막 경수장치는 물무게 압력을 통해서 그 멤브레인 표면에 있는 작은 미세한 기공들을 물 분자는 통과시키고, 그리고 기공보다 큰 세균 탁도 물질들은 걸러내는.
For my case, in a month I could spend 300,000 for treatment. Yeah, that's the problem I was facing right now. So even before the purifiers were brought, we could boil water with charcoal. That money we can save. The money for charcoal we can save and do other things.
저희가 아프리카와 동남아시아 전역에 스인성 질병으로 인해 고통받는 30억 인구에게 생명의 물을 전하는 그런 기업이 되고 싶습니다.
Okay, so Water Life is established in 2017 to provide water of life to the people who are marginalized from the safe drinking water. Okay. Okay. Okay, so this is the number of deaths due to the diarrhea, waterborne disease. It's almost 829,000 But I don't focus on this number, but focus on 3 billion who are suffering from waterborne disease, even though they don't die. WHO, they reported diarrheal disease can come from wash issues, and when there is a household water treatment system, the waterborne disease, diarrhea disease can be reduced as much as of 61%. So safe drinking water is a key solution. And later on, I'm going to share you what we have found in Uganda. It was not 61%, but almost more than 95%. And I'll explain you later why it is. So I think you are well known about the issues of waterborne disease, and it also costs a lot of social overhead. So up to now, many organizations, NGO, many people try to solve this problem. And each solution has advantages and disadvantages. And we try to overcome the disadvantage of the technology. Most of it, chlorination is a very effective one, but some people doesn't like the smells and odor from the chemical, And the filters, the biggest issue is clogging. Once you apply the very dirty water, it clogs immediately, so you cannot maintain the water purifiers. So we focus on this issue, and we develop a purifier which can be used with a very highly turbid water, which is really dirty and dark, black. And without the this is a very important issue. The point. Without the replacement of filter, water life purifier can last several years. Up to now, we test already almost 5 years in Uganda. So it can be operated, I think, over 10 years. I will show you the result later on. Okay, so sustainability, user convenience. User convenience means you don't need to do anything. You can just pour the dirty water into the purifier, and you get the clean water only by opening the tap. It's so simple. So rather than I focus on those explanations, I will focus on the what you really want to know about. Okay, so our purifier works with only gravity. Okay, gravity only, so no need electricity. Means it can be used in really deep rural area, and even in the disaster sites such as flood, and it can remove more the waterborne disease pathogens more than 99%. So almost all the disease, typhoid, dysentery, diarrhea, cholera can be prevented when you use water and life water purifiers. Okay, this is our product, and this is the result we tested in Uganda. So if you see that there is a borehole we are testing, and spring water, it's really turbid, and it can the sustainably operated. Okay, and this is the result of our field test, supported by COICA, and tested and implemented near the Victoria Lake shore. If you see the left side, it is occurrence of the waterborne disease, different types of waterborne disease before using water purifier. And the right side is after 2 months of water purifier is applied. Or if you see that, it's almost gone. Those waterborne diseases are almost gone. Only the one is the higher point you see is a fever, because it was a rainy season. So over 90% of waterborne disease were reduced. It's really, dramatic. How can it be? It is because our implementation site is near the lakeshore. So they have the water, enough water. So they have a custom to wash their hands before eating. So without the interception or of the other issue, we could observe the effect of drinking water only because they wash their hands. So through the drinking water, many waterborne diseases can be occurred, like typhoid, cholera, and bilharzia also. It will be gone if you use this water purifier. And here, if you can see, I would like to show you the water source, low water, but later you can visit our exhibition and you will see. It's really, okay, he's showing you, is this water. This water. And if you, okay, so could you please open the tap? Yeah. Okay. Okay. This one, we are testing almost 5 years. We did not bring new water purifier, but we are monitoring. So we distributed this one 2018, September, and it's almost 5 years. If you see that, still, it is working well. So this is our solution and technology. Okay. Yes, thank you so much. Thank you. So we are expecting, and hope this will be delivered to the students in Uganda. As I know, there are, okay, good. Good presenter. Okay, thank you so much. Thank you. Okay. So, okay. So this is interview from the villager we tested. They experienced the stomach aches and diarrhea was gone. And actually, in the village, there were 70 families. And we distributed only to 40 families. And then what happened? Can you guess what happened? The other 30 families, they start to go to the family who has a water purifier and share the water because they saw the differences. And good things of this one is not only you can drink the clean water, but also because they don't have waterborne disease, they can save the money for in the healthcare. And also, they don't need to buy a charcoal to boil water, so that also can save the family budget. Okay, these are certificates we got from Korea and Uganda. We got the test result from the Entebbe lab on the Ministry of Water and Environment. Okay, so I'm going to explain what kind of project we are going to implement next year. Okay, we are going to distribute, there are typo. Okay, we are going to distribute 30,000 water purifier units in 2,000 schools. We are, thank you. Thank you so much. We are already started the school survey. So some of the teachers, if they are here, might get a call from our researchers. And this is one project. And we are not just distributing the water purifiers, but we are going to provide education, sensitization, and annual visit to maintain the water purifiers. And one important thing is this project can be implemented only for the school that boils water for drinking, because this is a criteria of the project itself. So we are doing research, but for other schools that does not boil water, I'm planning to bring another project. Okay, so we are planning to launch this project 2024 next year, and the project period is 5 years. But if this project is successful, it can be extended. So for one school, this will be placed, and we maintain it, and we educate the students for 5 years. And then if it is still working well, we can suggest our funder to extend it. So another 5 years, another 5 years. So the cooperation of the school is really, really important. Okay, so we have a funder. They are going to support us with all these financial things, but we need also support from the Ministry of Education and the school, that security of the purifiers. If it is lost, then our funder cannot keep support. So the security of the water purifiers and maintenance through the teacher is very, very important. Okay, so we wanted to start this project earlier, but the issue is this is one of the UN project, and UN policy development is delayed. So we are waiting the establishment of the policy. So this is our funder. It is called EWP, Korea East West Power Company. It is owned by the government through KEPCO, so it is state enterprise. So it considers social impact very important. And we have another funder, Korean government. Our project is already reported to the Korean government. So they, as I heard, they consider our project as very good, very impressive. So we hope we have another funder to expand from 2,000 schools to 4,000 schools, 6,000 schools, and that we will see great changes in Ugandan school students. So these are the impacts. Reduction of waterborne disease, that is clear, but also they can save. They will be healthier, so they can more focus on the study. And one of my strategies is to choose school is when they were young, when they were in schools, they start to drink safe, clean drinking water. Then when they are grown up, they will still want to drink safe drinking water because they will experience differences. So we are investing to the students to make the changes. Okay, so impacts, health and gender equity, there's clean water and sanitation, and climate action. This one is many schools boil water to provide safe drinking water to the students. So when you use this water purifier, you don't need to boil, means you don't need to use the firewood, so that the carbon emission will be reduced. Okay, this is all of my presentation, and our work is supported by COICA and also EWP. Okay, thank you so much for listening. Thank you.
Thank you, Water and Life. Thank you so much for the presentation, but also for the submission. Given the fact that they may be leaving, I don't know if there are any questions specific to them, no, or if there are any specific comments that may be directed to them.
There are some questions, so, okay.
Thank you very much. My name is Connie Alesuyo from the Education Response Plan Secretariat for Refugees and Host Communities. Thank you very much for this exciting innovation. I was just wondering, in terms of maintenance, is it just the usual simple procedures of cleaning the container? How, I was very curious about that, because I see that it has a lot of possibility for the very vulnerable. Then secondly, I was also wondering whether you also work with other partners, if there are others who are interested in this kind of technology to be able to help scale up in other places, because I know you've tried around Lake Victoria, because I was also wondering if one wants to put it in communities along the Nile, for example, where there is the river, whether that's also a possibility or that is still pending the 5-year period, and then you look at that after. Thank you.
Okay, thank you so much for the question. First, the users does not need to do some special maintenance. After some time, the dust will be settled down on the ground. Then simply they can just rinse out. Yeah, that's it. So no need special care. And the other partners, we are open already. Yeah, we are going to, not after 5 years, but now we are already try to collaborate with many other funders. Yes. Thank you.
Thank you. Mine is about the capacity. Given that one, I don't know the capacity, is it 20 liter? Given the big school populations, to avoid refilling every other time, are there bigger capacities beyond that? And again, how long does it take? Is it instant? Immediately you pour in water, you start drawing so that we can manage the school population?
Okay, thank you. Good question. We have a bigger one, and this one you can fill 18 liters, and you can purify the water more than 30 liters per hour, the minimum. And then, we have on bigger one, it can be like 80 liters per hour. We focus on the flow rate because so that the students may not lose their attention to drink from this water purifier. If it's too slow, they just want you to go and drink quickly other dirty water. And so, depends on the like if it's a household, it can be slower, but if it's a school, it has to be faster. So we have different types of the purifier. Okay.
Thank you. Thank you so much. Peter is my name. My question is, Peter is my name. How do you, as an organization...
Kindly stand up.
Peter is my name. My question is, how do you, as an organization, identify schools, one, in the urban area where you operate, to fit in for the service? Two, in rural areas, how do you identify schools which need help? How do you identify schools which need help in rural areas? And I believe could be small, you're beginning small, but with the time, I think you would need to cover the whole country, Uganda. So how do you identify, especially in rural areas, schools to qualify for your service? Thank you.
Thank you very much for the question. I missed the first question. What was the first question? Could you? Okay. Connected. 3 questions are connected, right? So now we are doing this survey. We are calling to the schools, and we ask many questions to find out if the school is qualified for the project or not. And then, secondly, we visit them and check the real situation and compare from the survey result, and then we choose the schools. And so some school, even in a rural area too, we are going to, okay, our vision is to cover all the, schools in Uganda. So I don't want really small schools are behind and they are excluded. So, we try to include almost all the schools, even in the rural area. Yeah. So we do the hard research, and then we choose. And then the schools that does not boil the water, we are planning to cooperate with another funder. Yes.
I think those should be enough. Maybe the last, maybe we have the last one.
While I'm waiting, also we are working with the Ministry of Education to identify schools.
Thank you so much. Doreen Nabawanka. I work with World Health Organization as the Infection Prevention and Control Coordinator for the country. My question, that's a good innovation, it's very good, but my question is about how often should the schools get new supplies? Is the purifier, let me say, what is the shelf life of the purifier? How long should we expect replacements?
Of the filter? Oh,
yeah, thank you.
Oh, thank you. Okay, so we are expecting actually more than 10 years. We tested this water purifier. You will see in the exhibition, almost 5 years already, and it's still working well. So we expect more than 10 years. Only the thing we found, the breaking part is tap. Because young students, they like to play with the taps, so it can be broken. But filter itself is strong enough to last over 10 years. Okay, thank you. Thank you so much.
Hello.
Okay.
Yes, Reverend Independent, and I work with the Education Response Plan Secretariat.
Yes.
My concern is, can you train people on how to make this purifier, other than you keep on producing the purifiers, just to train either youth or in the schools on how to make these purifiers? Can you do it? Thank you.
Thank you very much, Reverend. That is true. So we are going to train people, local people, and not only our staff, but they are in the region. We would like to, train the people in that region so that when something happens, they can quickly go to maintaining. Also, regularly they can, educate the students. So we would like to cooperate with many local people and local organizations and the ministries. Okay, thank you very much.
Thank you very much. My name is I'm Jovita.
Okay.
I'm asking, in case someone wanted to buy it for home consumption, how much is it?
Oh, okay. Actually, now we are not selling in retail yet. I'm very sorry but the price is for our funders. They are buying the big quantity, so it is 150 USD. It's a bit expensive, but with one purifier, we are going to let 50 students can use it. And for 10 years, if you think about 10 years, it's not really expensive. Okay, let's say 10 years means $15 per year, and 1 month is just a little bit more than $1. Yes. So for long term, it's feasible economically. Thank you very much.
Thank you so much. Thank you for your contribution, but also for the innovation.
Okay.
A round of applause again for. At this point, allow me to invite the DEO of NAPAC local government to give us a presentation and on WASH in schools microplanning within the district local government. Thank you so much.
Thank you. My name's Joyce Nakoya, the District Education Officer, Napak District Local Government. I'm going to share with you a brief presentation on WASH in school micro planning.
Ladies and gentlemen, we have a room which is available for side discussions. For example, if you wanted to get some more information about a presentation, we have a room down that can be utilized for that. Don't feel as if you've been cut off. So you just alert me, and then I will be able to organize that. Thank you. Sorry.
Thank you. Just as I said, I'm going to make a brief presentation on micro-planning. We already discussed here yesterday about the challenges, the gaps in WASH in schools, and therefore my presentation is going to focus on those areas. The National Micro-Planning Handbook for Water, Sanitation and Hygiene was a report that brought out issues that affected schools and showed us what was in our schools. So my presentation is looking at that, and I want to say that Ministry of Education and Sports, we know very well they do recognize that improved hygiene practices and a clean school environment contribute a lot to increasing access, retention, and completion of quality education with acceptable standard of health. However, we noted yesterday here that there was a gap on data, and that gap that is in data was responded to in a WASH report that was conducted in 2019 and gave us the National Micro Planning Handbook that Napak District Local Government had to use in planning for WASH in our schools. Before the handbook, this was the status of WASH in our schools in Napak. You see the children on one side carrying jerrycans, looking for water, and on the other side you see them at a borehole struggling. On 25th of August 2018, a WASH program, Water, Sanitation and Hygiene program in Karamoja was launched. And in this program, it was supported by Korea International Cooperation Agency, KOICA, with UNICEF, with the aim of supporting Karamoja districts to deliver the national WASH in school standards in the region. The district of Napak was supported with 10 out of 30 public primary schools getting the WASH facilities, and then we also had support from Weltunga that gave us support in WASH. Some of the measures that Napak district had to take to track the impact of WASH interventions in school, we had to follow the national WASH school standards, which are set of about 24 standards updated by Ministry of Education and Sports in the year 2017. And some of them was at least 1.5 liters of safe water to be provided to every learner every day, separate latrine stances for boys and girls, and in Napak, before, if you go back to the handbook will show you that we had a few schools that had separate latrines for boys and girls. But today, as I speak, with the support from KOICA through UNICEF, our separate latrine stances for boys and girls is at least reaching 30 of our public primary schools out of the 38. So for us, we feel it was something that the planning helped us to achieve. Hand washing facility for every 40 learners with water and soap. We are at about 42%. We have not reached where we think we need to reach. Schools, we think that our schools need to budget to operate and maintain all school wash facilities. But we are looking at the parents' contribution in 10 of these schools that were supported in. Issues of hygiene, we already know about it, and it is one of the standards that are there that we think if we use to follow them, they will help us improve on issues of wash. And majorly, we target the school clubs. These members of the school management committee are trying to monitor the daily cleanness of these facilities in the schools. They get involved in them as their way of intervening in some of these areas. Key stakeholders involved, we have the parents, we have Weltunga, Hilfe, we have UNICEF, we have For Africa, and then the district local government. What are the key lessons? Proper coordination, this was mentioned here yesterday. Proper coordination will help us in aligning of resources for better results. We are also thinking that operation and maintenance requires a budget that should be embedded in the UP guidelines. What are the factors that made us successful in the implementation of this intervention? There was good political will from our political leaders. We have the sector development grant, although it's small, but at least every financial year we ensured to construct 5 stance latrines in our schools. And this came in from the report, the National Micro-Planning Report, that gave us an insight and showed us the schools that were doing badly and those that were better off. Availability of data, just as I've told you, that the National Micro-Planning Report is available for us, and therefore we had to use it. Gaps or challenges. All these challenges were mentioned here yesterday, and therefore I believe you are seeing the challenges. What I wanted to emphasize majorly here is the issue of selective interventions geared to specific areas by our partners. Most of our partners are looking at maybe government-aided primary schools, and the community schools are left out, and yet we are talking here about leaving no child behind. So that means we are leaving, in our interventions, we are leaving children who are in the private schools, we are leaving out the children who are in the community schools. So maybe let's focus our interventions to all the children so that we don't leave any child behind. A number of children, just as I've said, are left behind in those schools. The inadequacy of the facilities. We have the facilities, but they are inadequate. Look at those girls. They are waiting to enter the washroom to change. So how many hours will it take them to change if they are standing there? So that shows you the challenge that we have in the inadequacy of the facilities that we have in our schools. Despite the challenges, I don't want us to despair. WASH is picking up, and partners are intervening and recognizing that water, sanitation, and hygiene promotion and school environment are very important factors in ensuring increased access, retention, and completion of quality education. Recommendations specifically, I'm thinking of what everybody mentioned here about a specific grant that should be given to either to the districts or directly goes to the schools for maintenance of WASH. Thank you so much.
Thank you so much, DEO. Thank you for your presentation and for the good work that you're doing. Please, Joy, let's clap for DEO again once more. Yeah, so time is not our best ally. We really want to live here on time. We want to invite next the Department of Special Needs, the Ministry of Education, to make their presentation on WASH and disability. Thank you.
Thank you very much, colleagues. You are almost welcome. I recognize all the dignitaries around, and much has been said, but I want also just to give a few and direct presentation on WASH in schools and disabilities. So I will be presenting with one of my colleagues called William, from one of our partner called SHAU Uganda, which is Spina Bifida and Hydrocephalus Association of Uganda. So the projection, I beg the IT that let that first page be like that. I just give an overview, and then William will talk about these slides. There are very few, and then we move. Colleague, this is quite interesting story of WASH in schools and disability. You find that our children in schools are attaining education in the mainstream and at certain time in inclusive settings. So you find that WASH facilities provided in schools are intended to support all learners in primary, secondary, tertiary institutions, and universities. That is the main intention. But now when you look at the situation of the situation at hand, you find that WASH facilities on the side of learners with disabilities devastating. In the areas of, I want to quote an example of the universities where we have the WASH facility, the toilets is used as a public area for all learners vis-a-vis the enrollments. So the children or students who are on the wheelchair and those ones who are crawling, they have to use the same facility, and they will be crawling while there's water splashed everywhere. They have to pass through to access the toilet and use it. So we want to look at such a condition, a situation, and see, like others have said, how can we provide the best intervention to have all learners achieve in these education settings. And then also, in line with that, we find that in our schools, primary schools, our colleagues talks about maintenance and management. Most of the toilets are full and children are still using them, including those with disabilities who are crawling, but you find that the surface, the maggots are moving and water splashes as they drop in. So you find that now there is an impact on learning and teaching. As our children were presenting here, we're seeing, they were talking about risks in terms of infection. Now, who is more at risk is this child with disability, who is either on a wheelchair and one time will jump down to access the toilet facility and use, and also accessing now the washing itself becomes a challenge. The other area I want also to give a highlight, one of our partners, I think sponsored by USAID and the WUSHA program, you find that in those schools that they have been implementing the programs, they have a toilet called the Queen and another one called the King. Now the Queen is for girl children and then the king is for the boy child. Now, you find that accessibility also is another issue now. These toilets are far away from the classrooms, and these children with disabilities have to access these toilets. But now there is no a walkway from the classroom to the queen, or the ramp that goes right away from the classroom to the king. Now you find that accessibility becomes an issue. Then we are looking also at standards. Now we find that most of our schools have allocated a room for children with special needs. In fact, when you go there, you find this toilet and they have marked it, this is for special needs. Yes. But now the children accessing that toilet, those ones on wheelchair, for example, the doors are too small, and also the ramps at times are not there. They're also in the school. So you find that wash facilities are available at times, but accessing them by learners with disabilities becomes a challenge. Like other colleagues had said, management and maintenance is a key area that needs a bigger improvement if we have to leave no one behind. A bigger budgetary allocation is required, and to me, I would use this one as a publicity area that our honorable ministers who are here, we need a bigger budgetary allocation to wash, so we have clear management, we have maintenance. There are scenarios where we ask parents to contribute some little money in schools, but again, you find that also ministry says no contribution. Now you look at now management, there's no contribution, toilets are filled up, there's no emptying. What next? Smell everywhere, and you find some students and children, while they are going to ease themselves, they have to remove clothes, put them outside to enter and ease themselves because of fear of that smell. Yes. With those few overview, I want to call my colleague to give a case of one of the disability category that is really directly using wash, and we see how this wash is really implemented in schools, including learners with disability. So William, you're welcome. They told us we're using 10 minutes, but I think what we have is enough. Thank you.
Thank you so much, Jackson, and good afternoon, everyone. My name is William Eidu. I am standing in for the National Coordinator for Spina Bifida and Hydrocephalus Association for Uganda. That is Ruth Naluja. And we are doing this presentation jointly with the Special Needs Department of Ministry of Education and Sports, because we work very closely. We are talking about WASH in Uganda schools and disability. And we realize that in Uganda, there is many schools generally lack wash facilities, and this disproportionately impacts on learners with disabilities, even when it affects other learners, but the case is worse for learners with disability. My colleague has already given some insights. Now, based on a survey by World Health Organization and UNICEF, we realize that 34% of schools in Uganda have basic sanitation facilities. But then only 13 have hygiene facilities, and about 35% have basic water facilities. Now, this lack of wash facilities is probably and so much particularly affecting learners with disabilities. Imagine a situation of someone accessing a wash facility or a pit latrine, a toilet that's not very clean. So sometimes they find it difficult to enter, or they may not even enter a wash facility. Now, this is worse for girls with disabilities who face challenges during their menstrual cycle. You can just imagine such a situation. You need to help yourself, but probably the wash facility that's available is not very conducive. Now, I will only talk specific about disability conditions, spina bifida. Much as we recognize that there are all those disabilities that I have projected, which are recognized according to the Persons with Disabilities Act of 2020, I am going to give only a case of spina bifida. What is the situation of spina bifida? Children with spina bifida are no exception to facing all those barriers of accessing wash facilities in schools. Now, what is this condition specifically? Spina bifida is a congenital anomaly associated with the neurological and genital urinary disorders. Now, someone will have a malformed spinal cord, and then that affects how their urinary system works, and that impacts also on their mobility. Now, in most cases, children with spina bifida end up using wheelchairs. Some of them use crutches, and most of them definitely depend on catheterization to extract urine because the urinary system does not function well. On the other hand, when it comes to stool, they still have to use another process that helps them to extract the stool, not similar to most of us. Now, the accessibility of wash facilities is critical for them, definitely. Look at that situation. If one of us wants to help themselves, we go in the normal way, either you stand or you do squat, and that's easier for them. For them, it's very complicated. So that definitely appreciates that there is need for very clean wash facilities. Now, in addition to that, they normally face a lot of challenge with the UTIs, pressure sores, and other complications. Now, in most cases, the wash facility in schools are not accessible for them, including those specific children. Now, we have standards for wash, which are national in our country, and I'm going to talk about few of them and see how much SHAO is contributing. In terms of water in the schools, the standard ideally is that there should be a system to ensure clean water in the schools. And what we have contributed is that we provide some connection of water to some washrooms that we have constructed in the schools. And then the government standard is also that there should be implementation of a system to clean and maintain water collection, storage, and for that, we haven't done much. The next standard is around latrine. That this is a toilet, pit latrine, for children with disabilities. But maybe there is no access to that. A walkway, a path is provided the ramps. And in addition, we have also set up separate toilets for both boys and girls. There's a difference here. Now, what we've done is construction of pathways. We advocate for bins in the boys' toilets to cater for those that use Pampers. As I said, boys and girls with spina bifida sometimes have a challenge, and normally they have a challenge of helping themselves extract urine. So what we have done is that because some of them use Pampers, so we provide those bins so that the waste is collected there. And then we mobilize the PTA, school inclusion teams, to put new toilet structures in the schools, and then installation of water systems in toilets in plan for engaging the National Water and Sewerage Corporation. We work together with that to ensure this water connection in specific washrooms for children with disabilities. And then in terms of hand washing, what we have done is that through the school inclusion teams, we have encouraged parents groups to make liquid soap in their local way so that they can use that. And then there is ensuring soap at all hand washing facilities. In terms of operation and maintenance, we involve in monitoring together with the schools, the district education stakeholders, Ministry of Health and Ministry of Education. Then we do sensitization. And as I am getting closer to the end, in terms of hygiene in schools, the standard is that there should be hygiene education in schools. And what we have done is to create awareness about toilet etiquette among the school prefects, and then sensitizing the children, those with disabilities and all other children, to ensure that they wash hands. A few recommendations. One, we say that we should make wash facilities accessible for children with spina bifida and other disabilities, including ensuring that there is access. When we put a wash facility, ensure that any other person should access, even those with the wheelchair users, those with poor vision and they cannot see, and that should be provided. Then we recommend providing training to staff on how to support and assist children with disabilities in using the wash facilities, and then budgetary provision and prioritize wash that is inclusive for children with disabilities. Government and NGOs should work together to increase access to wash for persons with disabilities, including spina bifida and hydrocephalus. And then involve children with disabilities and technical people who know the standards and the needs when we're planning for these wash facilities so that they're inclusive. Then provide training to teachers and support staff on disability inclusion so that we have a community that is very inclusive of everybody. My conclusion is that access to wash for persons with disabilities, particularly children with spina bifida, remains significant. It's a challenge in Ugandan schools. When we address this, we need to involve the children, all other stakeholders, all other technocrats, so that we meet the standards that will help them. Ultimately, if we prioritize accessible wash facilities in schools, we will improve health, social outcomes for persons with disabilities, especially spina bifida. Some few photos on the work. This is a leveled and modified compound with a pathway for children with disabilities, and they are freely able to walk. And then this is in Kampala. A pathway was not there before on the left side. Now you will see that there is a very easily usable ramp for the wheelchair user to access a washroom. This is Police Children's School in Kampala. This is in Imbarara, where a wash facility is available and water is connected and the children are able to use and they are happy. And finally, this is a washroom in Imbale at Wokukiri Primary School, and the children are able to use. I would like to thank so much Ministry of Education and Sports for working very closely with us, and we continue to work together with all other partners that are ensuring inclusiveness for children with disabilities. I also thank our other colleagues that are within the disability inclusion. Thank you so much. Chow has a toll-free. Someone can call there, and then you can be able to access more information. Thank you so much.
Thank you so much. Let's clap for him again. Thank you for your presentation. Definitely the question of having the persons with impairment access and equally be part of all our programming is definitely a key priority. At this point in time, allow me to invite our colleagues from the basic education, from the Ministry of Education, to make their presentation on the revised sanitation design for schools.
Thank you very much. Ladies and gentlemen, a good afternoon. I'm Ronald Samuel Mukwana. I'm a civil engineer. Before I make this presentation, I want to inform you that Ministry of Education has a team of engineers and the Department of Construction Management Unit. And I have been attached to Basic Education Department. So I deal with construction in primary schools and ECDs, government aided only. I want to thank my bosses, led by Commissioner Basic Education, Assistant Commissioner, and the team, for allowing me this time to stand before such a high-profile gathering. For us engineers are normally sidelined. Maybe can I request engineers to stand up for recognition here, present engineers? Yes, we have only two. Thank you very much. I want to start from there to maybe promote. You see, what we are talking about here is kind of engineering. And it doesn't hurt if you moved with your engineer to come and see and also give us his views. But thank you those who have managed to carry theirs here. And I thank my boss, the Commissioner of Basic Education, for allowing me this time. We have made a few changes or adjustments or improvements in the latrines we are constructing under primary schools. And they are the ones I'm going to highlight. I will not really give you the details of the whole latrine block, but I'm going to highlight the changes we have been making to make them more and more user-friendly. When you look at that plan, the first change is the introduction of the footmarks or footrests. Since we are going for Eid, our friends from the Muslim community complained that when somebody went there and probably the urine didn't enter very well the pit, the next one, it is haram for somebody to step in another person's urine. So we have introduced the footrests in these latrines. First of all, it is a 5 stance that I'm going to use to demonstrate the changes we have made in our latrine. But others are there. We have a 5 stance for girls, a 5 stance for boys, and a 2 stance for teachers. Those are the standard latrines we have under Ministry of Education and Sports. The second improvement is the embedding of our pipes in the walls. You realize that we used to have pipes, the vent pipes. They used to be seen from inside the latrine stances. Now we don't want to see them. They should be along the walls so that when you enter the latrine, you don't see a pipe. But when you come out, you should be seeing a pipe. Why? Because we realize that, as somebody was complaining about the kind of odor in the latrine, they used to use dry banana leaves to smoke, to chase away that bad smell. But instead, they would just burn it from within the stance and end up damaging those pipes. So now we are embedding them within the walls. Another improvement is in the saturation area. We increased it from 1 meter to 1.2 meters. That is where you pass, you know. Now pupils can bypass each other comfortably. One enters, another is coming out, and the saturation area is now improved upon. This also stabilized that what we call screen wall or curtain wall. It is now more stable than it used to be. We introduced an incinerator. That small square you are seeing at the rear is a plan for the incinerator, and it is directly behind a washroom. So our daughter should come confidently, enter that room. It looks like any other stance outside, but inside there is no hole. So you change and you throw whatever you don't want into the incinerator and put on what is required, or the new one or the fresh one, and you come out when you are clean. And in that, we shall not be seeing you that you have gone into the incinerator kind of arrangement. You will be entering the latrine just like any other pupil or student. I can see some people implementing this, but constructing the incinerator far away from the pit latrine. When you do that, no girl will visit the incinerator. So you have to do it the way it is there. Another change we have made is the introduction of that, is the reduction in the door size. We used to have very big doors covering almost the hall. Now we have reduced it from 900 millimeters to 800 millimeters. That slide is just to show you what is below that plan. That is the lined pit. It should have that shape. You can note that the slab at the bottom is inclined, showing that whatever you are doing elsewhere is supposed to run and collect somewhere. And the other lower part, above it, you can see the access manhole. You can remove it when you are when it is time for emptying. So that is what I was trying to show in that slide. That is also the plan for our pit before it is covered. You know, it has a beam in the middle. So engineers, if you go and you don't inspect this before they put the slab, you will never know what is below it. And when it collapses, it will not be a design issue. A supervision issue. That is still the detail of the pit. Those are the substructure, that is the pit. Now here we are trying to show you that our slab is covering both the pit and the saturation area. It is one slab. Don't put the slab, it is around the schools. But also we would like, on this note, I would like to add that I don't know whether we can start looking at the fencing of the schools. I liked that period when we were in COVID. I would find all schools with fences. And that one minimized the vandalism and misuse of these facilities. Members, if we are to move forward, we should make sure that what we are putting in place remains in place. Otherwise, we shall be in the same circle. You put the break, and we shall remain in the same circle. We also, that slide is showing you a rate of in the stance for the pupils with disability. My league has been presenting about how we are catering for pupils with disabilities. It is a complicated topic because the kind of disabilities we have in pupils is what we are supposed to address as engineers. But now it becomes complicated when there are very many disabilities, and so we are looking at possibly the physical disabilities. And inside, in fact, our stance here is the biggest of all the stances on our block. So that one, I think we have got it right. And also the rail, you can see there are rails so to be used. They are slanted so that as a pupil enters, can get hold of the rails on the sides of the wall and be able to use the pit. We also provide ramps, actually, for that matter. There is no latrine, I don't know, unless not well supervised, but our designs provide for ramps. This one is a section through our incinerator, just giving you the details. And that is how our block should appear in front of the front view. You should be able to see doors. They are all similar. There is a changing room is the first door. But then the other 4 are for the normal pupils. Then where you are seeing that vent in the side of the block is where there is an access for the disabilities. And you can also see the ramp alongside that side. I want also to note that we put those holes in our screen walls with very good intentions. Why? Because when a teacher is in school, in class teaching, should be able to monitor what is happening between the screen wall and the stances. Some pupils can go there and they meet there and they discuss and they don't come back to class. So when a teacher is in class, should be able to see what is happening between the screen wall and the stances. And that one also gives us the orientation of these latrine blocks. Please don't put the latrine to face the other side of the school or any other side. Make sure they are facing where classrooms are. We also increased the height of that pipe, the vent pipes. In fact, even the numbers. We used to have 3 or 2. Now we have increased to 5, 6. Actually, they are supposed to be 5. They are supposed to be 5 and also a half a meter deep. So in the pit, it is not starting from the slab. It is starting from 500 millimeters down below the slab. And also the iron sheets, we have improved them. We are now using gauge 26 instead of gauge 28 as required by Ministry of Works. That is how our lined latrine should be looking as seen from the rear side. Another improvement we have made I can see slide 11, we increased vent pumps charge. Yeah. So the next one is just the appearance of the latrine, how it appears when finished. Members, that is my presentation. I want just to make a few remarks and leave lastly. I wanted just to call upon all members here to observe the coordination. As a person in charge of construction in primary schools, I get surprised sometimes when I reach some schools looking so beautiful. I just get surprised. You know, I visit a school, I look at it, I have a different version of the picture of the school. By the time I reach it, I find it looking very nice. Please let us coordinate so that the resources can be directed where they are most needed. Sometimes those schools are in our work plans, and you find that we have to fight a lot to change our work plans with the Minister of Finance to allow us to change. So it is not easy. So if we had a way of coordinating, we can use basic education so that each of us can say we are handling this in so many schools, and these are the names of the schools. So that even me, construction management unit, responsible for construction in primary schools, I can capture your effort and also present it somewhere. The O&M, operation and maintenance of these facilities, is really key, and I'm happy I was going to say that introduce a percentage of that capitation grant you put in maintenance specifically, because when you say management, then it will always be management. Secondly, on O&M, I would like to say we included a clause in the performance appraisals of head teachers. I don't know whether DEOs are really using it or not to measure the performance of head teachers. Because if a head teacher is not doing anything concerning maintenance of the structures, then that one should be, I think, reprimanded, because as you know, construction goes with maintenance. Once there is no maintenance, then we are not going to have good classrooms and latrines. And also, in that very area, we can still use the school management committees and improve on the maintenance of our latrines. But this is by identifying or also assessing the performance of school management committees. Someone wanted to put me on a school management committee when I went to my village. Said, now we want you to be the chairman of school management committee. Now, how can you be a chairman of school management when you are staying in Kampala and the school is in Bujiri? It is impossible. I cannot play that role. And I told him kindly, I cannot perform those duties. Get another person. School management committee should be responsible. We should be looking at that. Second last is the security and fencing. I've talked about it. We can also look at that one, that factor, concerning the maintenance and operation of our facilities. We can improvise, we can make live fences, we can donate fences and gates around our schools. Members, thank you for listening. I'm Ronald Samuel Mukwana, Basic Education. Thank you.
Thank you very much, Engineer. In my view, we probably need to have a side event to be able to understand properly these things. How do you construct what? How do you, you know? So I am very sure that there are a lot of people who actually have questions around engineers' presentation and input. So I would like us to agree as a team. I'm not going to dictate. Personally, I was going to say, but if you tell me that we get somebody to say something, we will do it. Now, people are dying. Okay, let's make a deal. We were supposed to be out of here by 1. But since you really want to ask questions, let's agree that we will be out of here by 2. Is that agreed? Good. All right. So we have, where is my colleague? We have 3 hands up. 1. Those are 4. They are becoming 9. Here, Timothy, that was hand number 1. Then the lady in black there in the middle is hand number 2. Then there is the lady behind there, hand number 3. I'll take that set. Then I'm going to take another set of 3. And we will be done.
Yeah. Thank you, Madam, and thank you, Engineer. My question is very short. I'm Meron Charsima from Kamwenge District. I wish to know if these approved designs are ready.
In fact, you can give me your email address. I tell the
Thank
architecture
you.
assistant, sends to you.
Thank you, Engineer.
Yes.
Mine is a request. I thank you, first of all, for the improvements made within the latrine stances. I just had to look at the way we are going on when it comes to improving wash in schools, especially. If I can draw back, some time back, we had latrine construction. I'm from Kalangala, members. And due to our soils, there are places where you could only dig 2 meters and you get to the rock. And there are places where you could dig 1.5 meters and you get to the water source. It so happened that it was partially from there that the lined latrine building was started. Then there was the EcoSan part of it, but it didn't move far. I'm just requesting engineers, is there a way you could think about latrines which could separate the urine from the fecal, from the feces? Because you'll find that the urine is too much. Our latrines end up filling so easily. Remember, we are in the agricultural country. We could use the urine like it is used as fertilizers and the other side of it. Think about that. Thank you.
Thank you very
Namted
much.
Josephine from Kalangala District.
Before engineer answers Josephine, I wanted to let her know we actually have a presentation on sanitation options for difficult soils. So I hope some of those issues will be answered there.
Josephine, on separation of urine, I want to add that what we have put here are the standards of Ministry of Education. And I want to inform members that anything above this is allowed. Anything below that standard is not acceptable. And therefore, whatever you can add, it's okay. It's okay. So long as you don't give us a substandard, what we are going to is fine. But at the moment, that is the design we have, and it is for emptying. Thank you.
Thank you so much, sir.
Where did that microphone go? It was for the other lady, please. Who is moving the microphones?
A minute.
Allow me so that we get organized, right? So move the microphone to lady number 3. Put up your hand, please, so they can bring it. Then I'm going to get a set of another 3 people. Thank you.
Thank you so much. My name is Barbara from Sironko in a school called Buteza. I think it is ringing a bell in his head when I mention it. Mine is a vote of thanks to him. He has done a very great job in that school, and it is one of the model schools youth project, phase 2. It is, I think, ranked one of the best schools that was constructed under his supervision. Thank you so much, Engineer Mkwana. But I'm getting to you one-on-one for a better discussion. Thank you.
Thank you.
Please thank our engineer. He's not just talking, he's actually working. At least we have evidence. Thank you very much, engineer. Okay, I'm taking another 3 hands, and that's it. Then we will organize a side event. Number 1, there is the MP. Number 2, and one who had snatched it. Number 3. And we are good to go. So start with the MP there, because you're near there. Then you come back here in the middle. And then we finish up there.
I want to thank engineer for the presentation. I'm Etuka Isaac Joaquino, Member of Parliament, Upper Madi County. Engineer, I want to thank you particularly about the proposal on the maintenance of wash facilities in schools, both primary and the secondary, and maybe other institutions. But much as you suggested that the school management committee and PTAs, maybe head teachers, could be involved, I think the proposal that the percentage for maintenance is specifically broken down, just like for co-curricular, administration and management will be a better option. And since we have the technical team from Ministry of Education here, I would suggest that going forward, I think we can break maybe the scholastic materials, because sometimes the ministry also provides other scholastic materials in addition to the capitation grant which is given. Aware that each child is given about 7,000 shillings, and that is a very small amount of money. So I think if out of the 30% scholastic materials allocation, some percentage is allocated for the maintenance in the UP grant guideline, it will be better. Then secondly, I request that you act as an ambassador, because you said you are only limited to construction of ECD centers and primary, and that's your jurisdiction. But we have the engineering unit for secondary schools and what have you. And why I say you should act as an ambassador is, we have a seed secondary school in Power Seed Secondary School. It is called Power. It is the over 1.3 billion project. But when you go to the school now, the toilets collapsed even before the commissioning was done. When you look at the school now, all the infrastructure in the whole institution is condemned, and this is a multi-billion project. So I think your suggestion that the supervision should be really done is very key, and I want to request that we do work which can really help this country, because Power Seed Secondary School collapsed. For those who are here, the whole structures collapsed before even the students could occupy it. And yet we have a full engineering unit. I thank you.
Thank you, Honorable. I have noted all your points. I will take them to the Assistant Commissioner Construction Management Unit. Second, we should improve the way we are managing. But also members note that under seed secondary schools, the project managers are your district engineers. For us, we are simply coming to monitor the progress of implementation of that program. So possibly that could be the problem.
Yeah, thank you, engineer. My concern is, I have two questions.
Yes.
Why is it that, okay, I will combine them in one.
First one, yeah.
Why is it that when you build toilets, you bring the walls so close, to the iron sheet so close to the walls that the gas from the toilets can even burn iron sheets, and they start developing crack holes. They rust. Is it possible for you to develop ventilation at the top of the toilets? You know, normally when children close schools, they come back when iron sheets have started rusting. And then I would have also expected that you tell us which size of toilet can be used for how long by a certain number of people, so that when I am having a 30 feet for 500 children, I can know it can last for this length of time. And this is just my advice to you. When you build a toilet like the size of my shoulders, make a slab which is as wide as, so that that slab cannot fall in. Thank you.
Oh, thank you. There are two.
Was that the second engineer who was in the house? Oh, okay, all right. So the microphone is going to the gentleman at the back, as engineer answers that.
There are two questions you raised. One is about ventilation within the rooms. That is still may be an area of supervision, because according to my design, or our design, or the design of Ministry of Education and Sports, I should not own them. On top of our doors, we have vents. So if our door is put in as it is like that, and at the rear side, we have those vents, and you have all the pipes, that one should not happen. And also, you should also note the type of iron sheets used. These days, we have some factories around. They give you something and you think it is an iron sheet. When you use it after 1 month, it will be rusting. That's why we are saying it should be gauge 26, and it should be really from a factory which is known for good quality. Secondly, you are talking about the quantity of the substructure. Now, this one used, actually I had skipped that. It used to be 25 cubic meters, and we increased it to 31 cubic meters of fecal matter. So it accommodates, and we don't expect it to really get filled up within in the middle of the term. Actually, some of them go for a whole year, and we have been advising teachers to empty during the December holiday, so that by the time they come back for January first term, the school is as fresh as they expect it to be. So I believe it might be a point of number of, because if you say we are using one and there are 800 pupils, I had somebody mention here, 800 pupils per stance, then that one really is overwhelming and it will not. But if we are using...
Thank you, sir. Engineer Peter, name. Mine is to add on what the Honorable was asking about supervision. There are really some schools in our country which really lack toilets. That's the reality. That even some are still schools under trees. But I think that will be handled. And the other ones, they have structures, but they lack toilets. The other one is the toilets already constructed, but they are substandard. Like he said, there is a multi-billion school, seed school, which was constructed, but before opening, it collapsed. So who is supervising that, and how can we be helped that we give accountability as a school head, and maybe the district, money for value to the government, to the ministry. The other one is disease control. There are schools which they fill up, the toilets fill up, and they take even 6 months without being emptied. And yet we would think the head teachers have the ability to empty these toilets. Are our kids not at risk to get diseases? Thank you so much.
Okay, thank you. I will start with the last one, disease control. I think that is why we are here. We are appealing to members that we are bad off in that area. And whoever can put in a coin, it is much welcome. And for me as an engineer, please don't crucify me. An engineer without funds is nothing. So what we should do is to advocate for more funds to come to this area. Actually, I agree with you in that area. Secondly, you talked about funds. It's the same issue. Without funds, you cannot get adequate number of latrines in schools. And therefore, without adequate number of latrines in schools, the hygiene part of it comes in. So it is all about funds. The inadequate supervision of per wall, I've ever reached per wall, by the way. But I told you that the project manager under that project was designed to be the district engineer. So he's in charge of supervision, he's in charge of quality control, he's in charge of time control, and he's in charge of the funds. How much money have you paid? What have you paid for? When are we entering our facilities? Those are the key roles of a project manager. So please, even in that case, don't crucify me. Is that all? I think we shall not exhaust questions from here. I request that we can write those questions and send them to me. I wish somebody could share my email address here and I get all your questions, because I'm capable of answering all your questions, but because of time, we cannot go any further. Thank you very much.
I feel like we need a session called the hot seat. But I'm going to copy from Reverend Enid, and I'm going to request the ushers to please move around. If anybody still has a suggestion, right, to write it down like this. Let us not wait for the email. Let's write this down like this, and then I'm going to request that Timothy, please pass this over to engineer. It's a suggestion from one of the participants. Ladies and gentlemen, thank you very much. This was beginning to get really, really hot, and yet we still had a number of things to work through before finishing. So for that matter, therefore, we have been listening to several presentations from the Ministry of Education, and I thought we needed to balance out a little bit. So you're going to allow me to invite somebody from USAID, Usha, to share something around social behavior change. Why do I invite this particular presentation? We had lessons before in a presentation made by Dr. Cleophas, and the lesson was that even if infrastructure is provided, if there is no behavior change, to me it was like carrying a heavy stone and standing in that one place. The physicians will say there is no work done. Even right now, from engineers' presentation and the reactions you have been making, there is something around our social behavior change that is pertinent to those different issues. Why is it that supervision is not done when it is supposed to be done? There is a lot around the way we behave. And allow me to call, you said, to please make their presentation, and we see whether we can add on what we have already learned. Thank you very much.
I suggest we stand up a bit and just stretch, like for a minute or less. We've been sitting since break time, and it's about lunch time. Let us stretch. Try to touch the roof. Try to touch the roof. Okay. All right, please sit. I'm called Jacinta Nekesa, and until recently I've been working with that project called Uganda Sanitation for Health Activity, which was funded by USAID, but the project closed as at end of May. So I'm going to share some experiences briefly from that project about social behavior change. This project was out to achieve what we call wash-friendly schools, which are defined by those 8 in the slide before, but does no harm to share with the rest of colleagues who have not seen it before. So the ones in blue were more indicators to do with infrastructure, the hardware. The ones in red were more to do with the software and the social behavior change that I'm going to talk about. For example, one of the things with social behavior change is that there should be someone in a school who is really dedicated to ensure that there is water and sanitation in that school, someone who is appointed by the school administration. So the things I'm going to share with you briefly now is what we did to be able to work with the children to change behavior in the schools. the psychologists have come up with a model. It's called the ERP model, the Elephant Rider Path model. That model says that in our heads, in our minds, there are two systems. One system is a system that helps us to plan and look ahead. A system that gives us direction. You want to change behavior among children, but what kind of behaviors are you looking at? What do you want them to adopt? Then there's the other part of the brain which has to appeal to the emotions. You want children to change behavior, but how are they going to do it? How do you what is going to motivate them to change? And then you look at the environment. How do you enable that behavior to change easily? So with this model, it says that if you want someone to change behavior, you have to give a proper direction and knowledge to that person on how to get to where you want them to be. What are those behaviors that you want the children to adopt? And then secondly, when we talk about emotions, you're asking yourself, how are they going to do it? What is going to motivate them to change? And then lastly, the path. As you saw from that elephant, it's supposed to be taking you somewhere. So how are you going to motivate that elephant, which is now the behavior, which is difficult to change? How are you going to motivate and ensure that the path which that elephant is supposed to take to get you to that destination, that path is free of barriers that might make it difficult for the behavior to be adopted? So, using that model as a project, we focused on 3 key behaviors. One was the practice of hand washing with soap and water. And that is after the toilet use, but before also eating. And then the second one was consistently and properly using toilets to ensure that children know that it's not good to defecate outside, to defecate on the floor of toilets, and that they should be able to use proper anal cleansing materials. And then the third one was around positive menstrual hygiene practices. So those are the clear 3 behaviors that the project zeroed down on to promote, but also we know that these are the 3 that impact on children's health when it comes to reducing disease. And I was happy when the children were singing and reciting poems about these behaviors this morning. So, what did we do in terms of, remember the elephant talks about the rider. So, for the rider to be able to know exactly where they want to be, we had to zero down on those 3 behaviors. But when it came to the emotion, appealing to the emotion, then we introduced a cartoon character called Soapy. You will see it very soon, to appeal to the emotions of children, to make it fun, to make them love what they were doing, and in the process being able to change behavior. But also we talked about the path that elephant is going to take. So what did we do to ensure that the path is clear for the elephant to be able to take you to the destination? We had to ensure we construct nice toilets, good toilets, because like you heard from the children this morning, the toilets should be good enough to be used and they should be loved. Then we also constructed the hand washing facilities, but ensuring that they are closer to where they are supposed to be used. If it is before eating, the hand washing facilities should be closer to the kitchens. If it is washing hands after the toilet, the hand washing facility should be close to the toilet. Okay? So that's just an example of the kind of facilities we constructed. The engineer was talking about ensuring that the incinerator is close to the toilet. That's an example of a girl's toilet. So we made them beautiful and appealing so that the children can be able to use them. The hand washing facilities. We constructed these, we call them group hand washing facilities so that they instill that behavior among the children to be able to wash hands before eating. And we installed them closer to the kitchens. Now that is a cartoon character that we developed. The children like to learn through fun. And that is a cartoon character called Soapy, but it looks like a piece of soap with lather on top of it. So for the facilities that we constructed, we ensured that we also paint nudges. Nudges instill, they help the children to recall and to remember messages. So if it was a girls' facility, we put nudges around hand washing, but also if it was a girls' toilet, we said this is how queens wash hands, and then we put the steps of hand washing. But the nudges were also painted inside the toilet blocks, so that as children are coming out of the toilet, they are able to see these messages and they're able to remember that yes, I'm supposed to wash hands after the toilet. We also developed what we call behavior calendars. So a calendar from January to December, and every month there is a message on hygiene that each month carries, and that's the message the teacher will be promoting with the children, and these calendars are hung in the classroom blocks. We also developed snakes and ladders. I think some of you have played this game before, but tailored to sanitation, so the children can play this game. It has small cards with questions around sanitation hygiene. So they play using those cards. They ask each other questions. If you get it right, you go higher up. If you get it wrong, the snake bites you and you lose and go down the ladder. We also developed posters. Posters would help the children then to be involved and to paint. They are able to paint, and those posters also have messages. And if you notice, if the behavior is good that you're promoting, Soapy will say, yes, that behavior is the best. If the behavior is bad, the Soapy will say, no, that is not good. If it is good, you'll say, yes, excellent. So that is an example. We'll talk about issues of MHM and boys laughing at girls. So Soapy is saying boys should not laugh at girls in their periods, and that is a bad behavior. But also boys should participate in cleaning their latrines, so that is a good job, that's good. We also developed what we call champion badges to help the children to be recognized. If they are doing well, they have done something good, or they have painted their posters very well, appreciate them, and would appreciate them using these badges. Then we developed jingles, and I just want to play for you a bit.
Wash your hands with the soap and the water. Every after you use, you will be safe for kicking diseases away. Because your health matters. So my brother, Soapy says, wash your hands. Because your your health matters. So my brother, Soapy says, wash your hands. My sister, Soapy says, wash your hands. Soapy says, you have to wash your hands. Wash your hands.
So, those jingles are again developed around the 3 key behaviors that I talked about that we were promoting. And so the children are able to sing this and be able to practice them, and in the process they're able to change behavior. We also developed teachers' guides. So we have teacher guides that then guide the teachers on how to use these materials and how to engage the children. Then we also did the training for the district officials, training for the DEOs, for the inspectors of schools on how to use these materials. We did capacity building for the teachers on how to use these materials. Now, one of the challenges was that the schools would remain waiting for these materials. So what we did was then to train the teachers on how to use the local materials like flip charts, like markers, to develop these materials themselves for sustainability. And then lastly is engaging the children on how to do the messages themselves, like the talking compounds. So really, this is a full package of social behavior change materials that have been developed by the project. Feel free to come to me if you like us to share these materials with you. Make use of them. Instead of reinventing the wheel and trying to develop new materials, these materials were tested, they went through a process, they were approved. So please make use of them and feel free to approach me if you like me to share with you some copies for your use. As long as you appreciate and acknowledge the donor who supported the development of the materials. Thank you.
Thank you very, very, very much, he said, for that presentation. And sharing is caring, so don't forget to reach out to her so we can all get these materials and share them. I'm hoping that the presentation will get back to our rapporteurs so that everybody is able to share and know what is going on. Ladies and gentlemen, we had earlier promised that we'll be having our lunch at the right time, which is supposed to be 1 p.m. Now, the deal was you agreed that we will push it a little bit. We don't want to go eat and then come back here. Do you agree with me? So if you can hold on to that hunger for a little more, then we can be in position to run through this, finish it, and then go have our lunch. And we say bye-bye, but not forever, because we will have a lot of work to do after this. So I see somebody is ready to come in. And are my children still around? Are they? Oh yeah, my children are still around. So as they are connecting, okay, the PowerPoint to this, Auntie Jovita, can I get those children to just come and let you know what they discussed? It called a presentation and endorsement of the symposium recommendations. It would not be nice for us to miss what the children are saying. So I would like them to share their recommendations as the next presenter is preparing his presentation. Thank you very much.
And I'm from Buganda Road Primary School. Now, just to give out in the other room, we talked about wash. Now, when we say wash, everyone understands it in his or her own way. But basically, wash is an activity done to promote sanitation and personal hygiene. Wash is known to us as students like an obligation or a responsibility. So everyone expects us to promote wash, but there are some challenges that we face that prevent us from promoting WASH. For example, shortage of water, shortage of soap, shortage of rubbish pits, shortage of water vessels, and in some schools there is a challenge whereby there are few toilets for the children to use and lack of toilet paper. So some children fail to promote WASH because of those challenges.
The things which we discussed about in the morning, the children's court, which was down there where you were not there. So allow children with special needs should be provided special toilet facilities. As you know that they cannot stand, even some of them they are lame, and some of them they need to be helped. And 4, schools should be provided with enough dustbins for proper disposal of rubbish. Thank you.
What would you want your school to do for you so that you properly practice WASH in your school? And the children gave these various answers. They said that they needed more washing vessels, enough toilet stances, more water, availability of more bins for dumping in litter, and they said that they needed continuous sensitization on how to use toilets for the ignorant pupils, and they also said that they needed enough sanitary towels for the girls.
My name is Ovliga Mariam Ramadan. I'm from Nachivo Primary School. For me, I'm going to just thank the Ministry of Education for the good work.
In Mata Primary School, Napak District. Children should, that can, a government provides schools to make children to promote proper personal hygiene is building toilets, building
good work.
My name is Sutim Emmanuel, Matany Primary School, Napak District. Mine is just only to thank all of you for attending this, and if you are invited, you need to come. Thank you.
My name is Chiganda Polycarp Pedrick. Me too, I would like to thank you all for coming to attend this function. Thank you.
To our listeners, thank you for giving us the platform. Thank you for inviting children to be part of this symposium. And please never leave children behind. They have ideas. They are just tired because when we were discussing, they were really vibrant, but it is okay and I think it's understandable. One thing they also pledged is to continue doing the good practices on WASH in schools as long as they are given the support. And one other thing they said is that as much as they know WASH, some of the children are adamant about WASH because when they go back to the communities do not listen to them. The community, when the child is washing their hands, the mother is saying you're wasting water. When the child is trying to bathe 2 times, like when the girl is in her messes, the mother is saying you're wasting water. So we need the support of both our communities and our homes and our schools so that we keep up the good practices. But short of that, we are good to go. Thank you very much.
I think now that your energies are low, we need to do it the military way. Asante sana. We are back. So ladies and gentlemen, please please, let's give him our ears. He's just going to take us through 1-2 things which are equally important as we are coming towards the ending. Thank you.
Thank you, moderator. Ronald Kavunga is my name, from the Gender Unit Ministry of Education and Sports. I would like to, I will have 2 presentations, but I will summarize in the shortest time possible. Related to the previous session, which was on behavior change, we often know that our children, in addition to behavior change, actually require life skills to change their behavior. So I'm presenting the life skill toolkit that would enable all the stakeholders effectively implement what has been talked about. We all know, owing to the COVID-19 saga that we had worldwide, a lot changed within the education fraternity, and you all know that this ultimately led to the need to have 21st century skills, life skills being prioritized, because a lot during that time, many of our children could not really bring out the key life skills. So the discussions within the education sector brought on board the life skill toolkit that will enable these adolescents live in the world of challenges, but also opportunities using the new technologies, but also the changing labor markets and environment within that. The development process of this life skill toolkit, like other legal and policy documents, of course, there was an establishment of the task force, and then we brought on board the consultant, and then the final draft was validated through different working groups, Intersectoral Committee on Violence, Gender in Education Working Group, and other stakeholders. And of course, the toolkit went through 6 months of pilot in 8 selected districts, and indeed the feedback from the pilot indicated that it was ready to use. Among the key feedback that came through during its testing, it was a simple tool. It had adolescent-centered methodologies. The parents could be integrated in the implementation of the toolkit, and of course aligned to the themes of the curriculum. As we'll find later, you'll find different themes that align to what is in the curriculum. For example, my body, my health, knowing myself, these are all within the curriculum, but they are integrated as well in the life skill toolkit. But the most important aspect that came through during the pre-testing was the fact that it aligned to the new guidelines on re-entry of the teenage mothers within the school settings. Well, we started from that, but what is it and why? Basically, the life skill toolkit focuses on 10 key competencies that are essential for the well-being, but as well the social and emotional development of the adolescents. It's basically, it's a module that has, it's a toolkit that has 7 modules, and basically all focused on promotion of these life skills, and in other areas, such as violence, peaceful conflict resolution, SRHR, resource management, as well as teenage pregnancy, but also bringing on board the social cohesion as well. This toolkit builds on the existing handbook, the journeys handbooks, the menstrual hygiene reader, and other materials from within the education sector. The target group for this toolkit is basically the adolescents between the age of 10 and 19, but most importantly, focusing on both the formal and the non-formal settings, those adolescents that are within the formal and the non-formal setting. This means that we can apply this toolkit both for the in-school but also the out-of-school adolescents. And the 10 core competencies that I was talking about include, they are reflected, some of these include cooperation and teamwork, empathy and respect, hope for the future and goal setting, critical thinking decisions, creative innovations, communication and expression, identity and self-esteem, leadership, influence, problem solving, but as well managing conflict, as well as coping with stress and managing emotion. If we critically analyze all these 10 core competencies that are coming through in this life skill toolkit, you realize that most of these adolescents, but as well as everyone in this room, requires them to promote proper wash in school. We can have the facilities, we can have the policies in place, but the other core aspect would be having life skills that make these children understand, for example, that yes, they have built these infrastructures, but we have to respect them, we have to really keep them clean, but most importantly, we know that such interventions that come in schools are for the good of my education. So they will need life skills to interpret most of these interpretation, but also connect them with their future aspirations. Now, within this life skill toolkit, you will have approaches that are kind of require an interplay between competence building but also active learning pedagogy. And when you are applying these methodologies, you will need a lot of practical kind of an experience, and the facilitators would require to integrate, to interact with the learners more often, but also use kind of participatory approaches that enable learners, first of all, to own, but in addition to engage and own the activities that they would have gone through. And there are also some kind of innovative approaches. You can apply the same toolkit. It can be customized in different cultures, but most importantly, different environments where it is being implemented. So these are some of the roles of the facilitator when he's facilitating using this life skill toolkit. And well, the facilitator, like the word goes, is just guiding and helping the adolescents understand or develop their required life skills using the activities that are within the toolkit. For example, in the toolkit, you will have a list of 7 modules. Module 1 is knowing myself. Module 2 is my body, my health. Module 3 on let's talk, staying safe. Module 4 and other modules as highlighted below. And indeed, as the saying goes, that it is a toolkit. Each module gives you a summary overview. In each module, you will find details of the session guides. You will also as well find a summary of information for the teacher or the facilitator, but also handouts for the participants to gain more experience, but also interaction within the activity. So you have 5 to 6 activities in the guide for each module, and you'll have details of the overview within the module. So what is the connection between the competencies per module? For example, you'll have module 1 that is on knowing yourself. So it has a certain competence it is promoting, which is basically cooperation and teamwork. Then module 2 also promotes different competencies as identified, including, which is on my body, my health, identification, self-esteem, self-identification, but also self-esteem. So basically, this is a toolkit. We'll have more details embedded. We'll have copies disseminated. If you want a soft copy, we can as well share with you. Trying to catch up with time. Someone is warning me. But most importantly, we'll have copies, soft copies, but we also have some hard copies in case you are interested in knowing more about this life skill toolkit. You'll come to the Gender Unit, Ministry of Education and Sports, and we have more detailed sharing, but also engagement with this life skill toolkit. I was also tasked to cement all the discussions that have come through within the room from yesterday, basically on menstrual hygiene management, and present to you the National Menstrual Hygiene Strategic Plan. I think we virtually need an aligned kind of intervention where all partners are aiming at the same strategic goals, and this guide is given by the National Menstrual Hygiene Strategic Plan that is in its final stages at the Ministry of Education and Sports. This is the National Strategic Plan 2021-2025. And basically, the purpose of this strategic plan is to provide national strategic direction for improvement of menstrual hygiene health, programming, and response for girls and women of menstrual age in Uganda. And in this strategic plan, why the strategic plan is basically to define the national direction, but also increase the operation efficiency and sustain the outcomes and impact of menstrual hygiene health programming by different actors, improve on coordination, but also to identify and effectively address the current and emerging challenges, but as well as document lessons learned from the implementation of menstrual hygiene health interventions within the country. I will not expound much on these legal and policy documents. They have been highlighted, but what is important is what is embedded in this strategic plan is based on the guidance from the legal and policy documents, including the UN Declaration on Human Rights. So basically, there are international commitments. Then we have the national policy legal and policy framework, as well as the sector legal and policy framework. Of course, I will skip, in the interest of time, that slide that basically looks at the guiding principles. Everyone has talked about most of these guiding principles in the presentations that we've had before, the gender aspects, but also government-led aspects and evidence. The vision of this strategic plan is a Uganda where menstruation is valued, appreciated, and supported for the dignity and well-being of the girls and women of menstrual age, so that they can participate in all spheres of life. And the strategic goal is basically to empower all stakeholders to promote the right to hygienic and healthy menstruation in the lives of girls. And the mission is basically to create supportive environment for all stakeholders to promote the right to hygienic and health menstruation in the lives of the girls and women with safety and dignity. I'll skip the next slide and go straight to the strategic focus areas for this strategic plan. We have strategic focus area 1, which looks at creating an objective understanding and appreciation of menstrual health and hygiene from the social and health perspective. And within that, members, ladies and gentlemen, all partners will now need to focus on these 4 areas, critical areas. Basically, development of information, communication, and education, education on materials on menstrual hygiene health for women, girls, and other stakeholders, but also support the development of menstrual hygiene and health structures for the knowledge enhancement in primary, secondary, and tertiary institution. This strategic area 1 also looks at supporting the development and strengthening of MHH information sharing and systems. So, just 2 minutes. Strategic focus area 2 is basically on breaking cultural barriers for improved menstrual hygiene management by women and girls of menstrual age. Strategic area, focus area 3 is on providing adequate, safe and hygienic materials, as well as products and facilities, as well as services for menstrual hygiene management. Strategic area focus 5 is on creating a more effective and enabling policy, as well as legal framework for MHM. So basically, those are the 5 strategic areas. And then this strategic plan looks at the key implementation approaches, including public-private partnership, male engagement, media advocacy, community engagement, social inclusion, collaboration and coordination, advocacy, lobbying, capacity building, and others as they are indicated in the detailed strategic plan. Thank you very much. I will end there. For more details, again, I will share this presentation, but as well, you can contact the gender unit, Ministry of Education and Sports, that is chairing the MHM coalition, to have all these details given out. Thank you very much.
Thank you so much. Please, a round of applause. Thank you so much for your presentation. Just to recognize our members of parliament joined us. We have Honorable Silas Ogon, the chairperson of the WASH Forum. We have Honorable Mutiwa Geoffrey. Honorable, you're welcome. We have Honorable Adrico Yovan. You're welcome. We had Honorable Isodo Stella, MP Ngora.
Like children who wash. So as those children are concluding, remember the questions we had about the designs. Did anybody write anything so we can pick it up, please? Don't go with our ideas. If there is anything you wrote, put up your hand so we can find it. Thank you very much. Put up your hand and we get those ideas, please. We need your questions answered, so don't go with those questions, please. I see engineers are bringing they might be constructing a proper latrine very soon. So hang in there and we see what they are going to be constructing. I see pipes and, you know, all things are coming around. Questions, please. Let's pick them up. I could also decide to get more interesting by asking us to share one learning that you have got from our talking and meeting and discussing and eating. I will not forget that one. They reminded us we are here, we eat. Those children. Anybody with a learning that you feel this is something I should take from this discussion? Yeah, thanks. As we give a few minutes to our engineers to construct, let's hear that learning that you want to go away with, which we will add on our recommendations.
I am Philip Orema, the District Education Officer, Noya. district local government. In our sitting here, I saw a number of things in the different presentations that were made here that can make me to come up with some few recommendations. We have seen gaps in the management of water and sanitation and hygiene in our schools. Therefore, this made the following to come in my mind. The first issue is, in this country, universal primary education has been implemented for the last 26 years. This should have helped us to restructure our community. In that, when we move to community, we still get LC1s who are not able to write and read. So I recommend that there should be a total review of the universal primary education policy of this country to adopt a sustainable development concept so that it can include the content, the new content of water and sanitation of this country. Because there has been problems that has been noted here, but where are we handling them? Number two, we have talked about technology, and I recommend our colleague from Japan who are here, that the new concept of water and sanitation technology should go into the curriculum of vocational schools we have here, such that we have people who can produce these water and sanitation items for us in this country. I think those are the two things that I saw, that we need to adapt the technology into our curriculum and review the universal primary education and universal secondary education policy to adapt to our development. Thank you so much.
Thank you.
Thank you very much, DEO. I see how UPE is smuggled there and then wash coming in, and you see, so that we are holistic, right? We just don't talk about the issues, but we make sure they are streamlined through the education. Yes, please.
Thank you so much. My name is Iba George Butele. I'm the District Education Officer of Madokolo. I'm humbled that we are here to secure the future of our children in terms of wars, and we have a theme which has a key message and value that we are leaving no child behind. I strongly believe we are here as a government, we are here as development partners, but our scope of leaving no child behind is very narrow. Narrow in the sense that we are not taking care, and there's a lesson to learn that we need to do a lot as a country to look into the issue of the children in the hands of the private investors in the education sector. Now, if we're talking about leaving no child behind, what about the future of the children in private schools? And yesterday we were presented the data which was collected in 2018, which is 4 years old. That means even the current status compared to us as government on the public institutions. This house will look into an issue of how we are going to broaden the concept to ensure that the entire country, the children in this country, Uganda, are taken care of, to ensure that we are safe, our children are safe in schools. Then I am very happy today, engineer taught me something, that there is also a good crack, which I will have, if I had not come here, I would have not learned about it. Now, what interventions are we making as government to ensure that the private investors in the education sector adopt the decent and well-stipulated structures for purpose of works and other infrastructure development in our schools? Thank you so much.
Thank you very much, DEO. Those are DEOs, eh? They are the people very near to the final beneficiaries of what we are discussing. So DEO, we have been listening to policies around here, and I believe everybody, private or public, should be fitting within those policies. So you're very right, when the engineer is communicating about those structures, it is not just for the government institutions. It is everybody, including the private institutions. So they should be working according to those guidelines, not their own. Thank you so much. People, there's a teacher there. Let's hear what the teacher is going away with. She's behind you. Didn't I tell you the engineers are coming?
Okay, my name is Chomjisha Patience, a teacher at Uganda School for the Deaf. So I got an opportunity to be here yesterday and today. I think I've been sitting here and I've been observing since yesterday. All I can see is the passion with the people who are here, those who are presenting. So as a teacher, I'm motivated to go and talk more about WASH, because I know as we are working in schools, also organizations are working tirelessly, government is working, the ministries are working. So I'd say I'm grateful because some people don't take WASH as important as the way we did today. It looks simple as simple science, but in these 2 days I see it's complex and wide. So we need to do it more as a teacher, sensitize my parents, my community, and my children. Thank you.
Thank you so much. Actually, that hand clap should be louder. You know those poems we've been enjoying here? Hey, those are the trainers of those people, so that we can have them presenting and we enjoy what they are saying. All teachers here, I recognize your presence and we totally appreciate the work that you're doing. Thank you so much.
Yeah, thank you very much. From our interaction, the 2 days that we are concluding today here, I have realized that the issue, many experts have deliberated on these key aspects around WASH. Me as a person, my name is Patrick Edet. I'm from Zenith Education Scholars Africa, from the private sector. I have realized that the problem is not about money. Allocation, MPs are here, they have talked about allocation. What I have realized from this debate, we need total mindset revolution change in this country. Because if we cannot manage to maintain the little that has been allocated by the Ministry of Finance or by government and other stakeholders, we corrupt it. The issue is, how do we make stakeholders be responsible to take up the actions in maintenance of what already we have in place? A case in point, the Honorable Member of Parliament from West Nile said here, there was a project that constructed, or there was an entity that constructed $1 billion facility in West Nile. But because of lack of maintenance strategies, all it has been what? Crippled down. And we are here lamenting we need resources, we need resources. So until we have that mindset, a turnaround as a country from all levels, at individual, family, up to the national. We will lament here, but the Bible says if you don't manage to maintain the little you have at your courtyard, how best can you maintain the other big one that will come? Thank you very much.
Thank you so much. And having gone to the Bible, I am going to say we are ending with the book of Lamentations here, and we are going to the book of Acts. Trust us, the people who have come here are that serious. No more book of Lamentations, Reverend. The book of Acts. Ladies and gentlemen, my team is ready. Allow me to invite Nachivubo Blue to finally send us off in style. Thank you very much.
Are you trying to waste our water? Ani again okusaba biru ya mazi galugoywa mibaka bya kabuyonjo.
Get to know your limits.
Your limits.
Obuyinzabo ukomeri jokomeri na onentamu. So don't dare me anymore.
Look at you.
Look at me.
Don't you know that this stuff follows under my office?
Wanjitata. In your office. Forgetting that you are in charge of saucepans and mingling sticks.
For your own information, our boss entrusted me with this stuff to cut out the outer bills.
Over my dead body. Oh, that's why the school has been suffering. Because of you.
Listen.
Katisebo. Gena kwesa gana amazi. Oklongosa latrines. Nebi nabido. And from today onwards, I'm the one in charge of his staff.
You are the one in charge?
Yeah.
Okay. I have said stop. Or else, nina kukuomu now. I always tell you that never drop a drop before the drop of you. Katimbala bidding a moving the boutique. Chichi! Cutting chocolate. Chichi. And I say, keep it. Chichi. Who did that? Not to leave. He said, I can't go to the get out now. Si. Mwen. Katimbala bidding a movie. Chichi. Of course I'm doing my job. Tell you. Stop. True. Is that you? Problem of this school. Is a civil and the cock is you. Impossible come up. The young of Funansi Watape. Moment that you see.
Doing your job. Really? I have been blamed not to clean the latrine. I have the option of getting water. Imagine pupils fall sick every now and then, suffering from typhoid, diarrhea, and others cholera,
because of poor hygiene. Yet you're the cleaner.
What you doing?
Now, if I may ask, do you boil drinking water for these pupils? Do you?
Ate sibalabanga imbulwe enku ezifumba amazzi g'akawunga n'ebijanjaalo ate nfume n'ag'okunywa mbu drinking water. Better ask my boss.
No wonder.
Nyabu woba wakuwanda towanda wano genda wane muzisiki beza ziteziwunyanga ki
every day you get a lot of cases.
Nebikwatyako wo.
Let me go to the head.
Go.
No, even if there is a meeting, this is an emergency. It can't wait. Of course, I will let you in the chat. Let me go now.
Abagezi amatono gakoya bigere.
Hey! Iwo!
Era mushawolera ddala.
If Pakaza was human.
Ani yekaza.
Leo kuba tafukuza okazaki.
Mulimu n'okufukuuza.
Era bagenda kugoba.
Ani.
Wamma mufuna amazzi ag'okunywa mumale mugende mu kibiina musome. You're welcome. Hurry up.
Mukanya lusemba yata buli amala agenda mu kirasi. Mangwe! Muvire!
Shikuluma.
Tekinnaba.
Because I'm the one in charge of this tab. Commander in chief.
Wanji? Chief in commander?
Yeah.
Ati musaze buli omukulopa.
Twakulopye yodda.
Mwanda opye yodda.
Tawededda.
Kati nange ngenda gamba omukulu w'essomero engeri abaana gye babasa mpatize emabega ddomu kiki
ate nawe tokisusa nnyo bwotyo.
Sisisusa.
Tosobola kusirikako.
Tonsirisa ngenda kumugamba oba kali katufe
olugambo omusajja ogukula ogutaswala
ate gwe omuto nonakupampa nja kugoya nze bano bengoya gwe nja kusiika buno bwesiikasiikanga buno. Mukama wange oli osinojja taasa ku bantu bano wamma mukama wange si gwaŋŋamba nti nabira amazzi gano baleme okugakozesa obubi. Nze mukama wange omulimu gwe wampa ngukola bulungi nnyo naye abantu bange ne bagezaako okunnemesa. Yes.
That's good. I still beg your pardon. Did I hear you right? Unbelievable. Good enough in your office. I introduced myself to you that I am Stella,
wamama babuuze era mubuuza biyita gaasi nettapwe okulongosa manti wa ddomu kiki ate buti bannange sina kuzifumba amazzi g'akawungu n'ebitanda ate nfume n'ag'okunywa nze mukama wange yaŋŋamba nze bajeti
Whose fault? That is good. Mufuba. How is it done? That's why we did our best to bring this water here. Which water? Of course this stuff. Because people used to fetch water from the swamp down there. Where? Of course there. Can you imagine the lessons? How can another go there and enjoy the activities being done there? Most especially girls. Clean. What's your... Members, let us not waste a lot of time arguing. Madam said, I think you can help these people. Please, we promise. We as Welonje and PSIU, together with JIZ, we are going to work hand in hand with the school administration, and we are going to provide liquid soap, gels, brushes, squeezers, plus the hand washing vessels for the task. Thank you so much, Mr. Kano. Mr. Kano, not only those, we are going to provide a water tank for drinking water. Thank you so much, Madam. And Madam Timothy, yes, please. It's your responsibility as the head teacher of the school to see that all these things are put to a proper use. Oh, Madam said, there I will have no excuse. I will handle that with my team. Thank you.
I start, some reminder. Girls, how are we? How are we? That's good. No more misuse of our garments, not so? Wonderful. Okay, back to the issue of hand wash. This is how we wash our hands. Open the tap, pick up the soap, wet the hands, rub the soap to form lather on hands, interlace the fingers, clean the fingernails, rub the middle palm of both hands, rub the back palms of both hands, rub the wrist, rub the thumb, rinse the hands with clean water, and then shake the hands to dry. Have you understood? Now, can I have someone to come and demonstrate for us how to wash hands properly? Come. This is how I wash my hands. This is how I wash my hands. I open that up. Pick up the soap. Pick up the soap. Rub the soap. Rub the soap. Front, back and front. Side by side. Shake, shake, shake. Now I know my hands are clean. Wash hero! Wonderful! Come, my daughter, come! That makes it clear that everyone has understood. Clap yourselves. Allow me to take back the microphone to the head teacher.
Thank you so much for that wonderful session. Now, pupils, asante sana. Thank you. Dear colleagues, before we come to the end of our occasion, allow me to show you how we have managed the solid waste around our school community by turning the used plastic bottles into a beautiful fence. This work is done by our boys, and then the girls are the ones in charge of that display. Once again, allow me to invite Madam Stella to take us through the last session of our day. Madam Stella, you're most welcome.
Thank you so much for the warm welcome and the love exhibited. All protocol observed. My work here today is very simple, but before doing it, allow me to thank the management of Weyonje plus TIZ, together with the school administration, that has worked hand in hand to put this in place. Ladies and gentlemen, I am hereby officially handing over this water tank to the school administration to be used for the safety of our pupils and the entire school community. In the name of the Father, the Son, and the Holy Spirit. Amen.
There is no way I was this event here I couldn't miss. I don't know how you remained sitting, but for me it was amazing. You people, who hasn't learned? Who has not learned from that? And it is from that angle that I am requesting. I don't know whether we have movie directors here. Did we invite them? But really, I was requesting that these children are supported. We document this thing visually. We take the thing to TV. We take the thing to other schools. I don't know what you think. What are you saying? So can we begin by getting, where are these media people? They disappeared. The media people, are you around? We want your contacts because we want to know where to begin from to ensure that this is recorded. Before we start running around to say how are we going to pass on this message, we already have people who have designed the message for us, and they will get that message to very many different people. So as part of our recommendations, I'm requesting that that becomes one of the things. I'm sure one of us is probably going to stand and say, I am starting to take the responsibility, and I have put here, I don't know how much, so that we begin on that journey. As we think about that, ladies and gentlemen, I request that you subscribe on the Ministry of Education YouTube channel. We will be sharing a link with you so that you get to see the events and possibly also enjoy this one again. We are also going to be putting what was covered yesterday on that YouTube channel. Don't just click and then look and then continue. We want to continue advocating for this wash. So I expect you to click and put messages there so that we get it active. Thank you very much, ladies and gentlemen, for the patience and for your support. As we come to the end of the day, I am not even sure I am that big to invite the person who is supposed to be taking us through recommendations that we have picked as we go along. I think I have been graduated. Okay. I'll organize my quote and then begin. Ladies and gentlemen, allow me to invite the Commissioner of Basic Education to come and take us through the recommendations as we have been picking them along the way. The Commissioner will then do the honors to invite somebody who will be closing us off. I am not that big. I request that you welcome the Commissioner. Thank you.
Thank you very much, Master of Ceremonies. The chairperson of the Uganda Parliamentary Forum on WASH, other honorable members of Parliament present, distinguished participants in your various capacities, our beloved children from the various schools, the media, ladies and gentlemen. Today is yet another beautiful day as we come to the end of the first WASH in School Symposium at Hotel Africana. I want once again to thank all of you for having spared part of your valuable time to attend this very important, historical, and memorable symposium. Thank you very much. That kind of clap is below standard. Thank you very much. We are leaving this symposium energized, resilient, and determined to take forward the WASH in Schools agenda since all of us believe that no child should be left behind. I want in a special way to thank the Uganda Parliamentary Forum on WASH, who led the organizing committee in ensuring that this symposium becomes a reality. Please give them a hand clap. I would also like to thank the organizing committee and all the partners that supported us to ensure that this symposium takes place. I would also like to thank the management of Hotel Africana for the good services rendered to us during these 2 days. In a special way, I would like us to put our hands together and appreciate all the children who have participated in this process. I would like to thank our two distinguished Ugandans, the gentleman and the lady who have been the master of programs. Thank you for the job well done. I'd like to thank all of you distinguished participants. You have been wonderful people. You have played your part. Thank you for being active participants. Ladies and gentlemen, one scholar called Oden said, thousands or millions have lived without love. Not one has lived without water. That shows you the importance of water in our life. And the word wash starts with water. But I also want to remind you of what Kofi Annan said. And this is what he said. Shall not defeat any of the infectious diseases that plague the developing world until you have also won the battle of safe drinking water, sanitation, hygiene, and the best health care. Ladies and gentlemen, WASH starts with you and me. Let us leave this conference as disciples of WASH, and let each one of us play his or her role, and we shall therefore stop reading from the book of Lamentations and focus on the book of Acts. I want to make a special appeal to all the presenters that from this symposium we are going to publish a WASH journal. So I'd like to appeal to all of you, whether you have made the presentation or not, please send your article or your feelings to Mr. Musa Birungi, who is our coordinator, Minister of Education and Sports. They should be able to project his phone contact and the email address so that we're able to receive these articles, review them, and be able to publish a very good journal out of this first WASH symposium. With those remarks, allow me now to read the agreed action points before I invite our chief guest to officially close the symposium. IT, I think, can project as I read. Agreed actions under advocacy and capacity building. We shall strengthen advocacy through the Parliament of Uganda and engage the Ministry of Finance, Planning and Economic Development to allocate more funds for WASH activities in schools and institutions of learning. 2, provide support to strengthen a WASH hub within the Ministry of Education and Sports to facilitate the provision of better wash facilities and services in schools and institutions of learning. 3, equip the relevant stakeholders at lower local governments and school administrators, including senior women teachers, senior male teachers, members of board of governors, school management committee, PTA, cultural leaders, religious leaders, with skills in lobbying and advocating for WASH. Second issue is school infrastructure and investment. Action 1, lobby Minister of Finance, Planning and Economic Development and government partners to increase investment in sanitation and infrastructure so as to be able to reduce the poor ratios, for example, the 1 to 40 pupil stance latrine ratio. Number 2, develop guidelines for latrine emptying for all schools and institutions of learning. And 3, lobby for the establishment of the fecal treatment plants to support latrine emptying for schools and institutions of learning. Number 3, construction and design of sanitation facilities. Action 1, construct separate toilets, latrines for children in schools with the ECD nursery section, specifically for government-aided primary schools with pre-class attached to reduce the risk of infections. 2, develop and issue designs of safe urinals for girls in schools with high pupil stance ratios. 3, enforce guidelines for construction of toilets, latrines in schools to include a stance with facilities for learners with special needs. 4, replace single tap with multiple hand washing facilities. Number 4, hygiene practices. Action 1, enforce hand washing to sustain gains made during the COVID-19 pandemic. 2, sensitize girls on the use of incinerators and changing rooms where available. 3, orient teachers on the curriculum and the teaching of menstrual hygiene management. 4, enforce health parades in all schools. 5, to ensure safety and security, all schools should have fences. Number 7, support the formulation of functional wash clubs in schools. 8, assign a wash focal teacher to coordinate wash in all schools. 9, strengthen community engagement to sustain the best hygiene practices. And 10, promote training programs focusing on wash in schools. And the last item is to review achievements and share the best practices. And I hope that we shall plan for another Ocean School Symposium in 2024. Those are the agreed actions. We shall refine them and be able to share them with you, and we shall include the responsible centers and the time frame. With those remarks, I want to take this singular honor and opportunity to invite the chairperson of the Uganda Parliamentary Forum to come on WASH, to come and close this first WASH in School Symposium. Honorable, you're most welcome.
Thank you so much. Let's clap for them. see Honorable Mutiwa Geoffrey, Honorable Agriko Yovan, Honorable Isodo, all the way from Nora, that's my neighbor, Honorable Atoka Joaquino. From yesterday up to today, they have not left this place. They made it almost residential. So if you are not mean with your clapping, you can clap better for them. Let us clap for the person who has been interpreting, I don't know, sign language. They have done it throughout, almost 48 hours, I would say. So that is what they call leaving no one behind. I say so because WASH is not for a particular section of society. It includes the PWDs. And I'm so excited that these days we are taking this particular aspect seriously to the level of microphone level. When somebody is speaking, there is somebody interpreting. I'm so excited and I like it about that. Number two, before we close, I want to extend my sincere happiness to the Ministry of Education because they have done such a wonderful job. This is the first time we are holding this symposium, but the attendance, the participation, the level of interest, commitment, seriousness, appetite, oh, name it. It has been thunderous. Parliament is sitting right now, that's what I want to believe. But the members of Parliament decided to stay with me up to this time. Meaning that we have given all our hearts to WASH. So our issue is that we've listened to the recommendations that you have enlisted here. So for us to make them practicable, this team has to work. And that's why they are here. So we want to pick from you, we deliver, we want to have a meeting with the speaker so that we relate to her the findings, the observations, the recommendations of this gathering for action. Otherwise we shall be wasting our time. We don't want to speak to ourselves. We must speak to government so that government can act. So we are going to take this back to the speaker, share with them so that we see what comes out of this. This particular year, we have this theme. So between this theme and the next theme, there must be something that has changed. We don't want to keep on changing the themes without seeing results of the previous theme. That would be the way to go. So this thing of just, this is our theme today. Then we go and bury that. Then we wait for the next meeting. We create another theme. It doesn't work like that. We must follow to see that results come out. For me, that is the way to go. So let us not just keep this. So for the 12 months that are going to be ahead of us from today, let people do work along the recommendations that were made. For us as Parliament, you can be able to even tease out and say this is for them out of the recommendations. Because if you are talking about, for instance, latrines, sanitation, menstruation, how would they call it? Menstrual hygiene. That one. It's a difficult one. Yes. We need to change something in our planning. For instance, when they are planning and designing the toilets, the pit latrines, they must now put that aspect of menstrual hygiene. Somebody talked about yesterday the issue of cleaning up, emptying pit latrines. Sometime back, I think in Kampala, it was decided that each people at least contributes 1,000 shillings in either a month or a term. Something like that, towards this operation and maintenance. But you know, government has been cagey about this. They said no child should be paying money in a UPE school towards this kind of intervention. So, but the question now we ask is, we put a stop to that. Where do we go? For that reason, we vote as Parliament to convince the government that the way to go is to find the money, put it in the plan, so that whenever you are constructing particular things, you also find money for operation and maintenance. Then things will work. That is how it works. In Uganda today, there are places where you cannot get water within a radius of 5 kilometers. So gender-based violence comes on board. Because some men believe that when a woman takes long to come back home, she's with another man. And yet the man is actually washed, looking for water. Those are the challenges. You see, you come back, you are clobbered, they beat you properly. Yet you are bringing water for somebody to drink, and that is his life. You see? So it is something which is like a this, like a this, like a that. It's a real challenge. So colleagues, I wanted to say, whenever you pray, things will happen. 2026 is coming. You are going to make it back to Parliament today. Because you are standing on the wash. Yes. Yes. When you clap, it means you are saying amen. If you are not clapping, then you have a problem. Most especially the backbenchers, they are quiet, they are not clapping. Okay, so the clapping session, we start with the Honorable Etuka Joaquino. Let us clap for him so that he returns back to Parliament. As you go and sit, because I don't want to over-disturb you, let us clap for Honorable Isodo Christy Stella, all the way from Ngora. Ngora is a part of the greater Kumi. So she is my immediate neighbor on the other side. So Kumi has been the most committed participant in this particular event. Because yesterday I had my woman MP, today I have my neighbor. I have been here all that time. So you can give us that thunderous, yeah, as she goes to sit. You will return back to Parliament. I'll pray for you. Yes. Honorable Yovan Adrico, a man who got married recently, he needs a lot of water for the family. He has done very well. The man is looking healthy because of wash. So Honorable, as you keep them, not now the new catch. I don't know how to put it. May God bless you and you return back to Parliament, curtains of wash. Thank you so much. Honorable Mutiwa, I was in his conference just yesterday but one. You know, we lost a wife to one of our colleagues to an accident in the border. Conflict is becoming another challenge. Where people are dying, I think it's 12 on average per day. It is a serious mess in the country. So we're there. I know him, youthful, very handsome man, a lot of water in his home always. He needs to return so that he takes care of the family. Now we pray for him through clapping. May you return back to the 12th house. I want to applaud the children. Nakiwibo Blue. Oh, yesterday they performed wonderfully. Again today they have performed. And for your information, the 1 million shillings that are promised as a person, I sent it. So I don't know where teacher is. Teacher, did you see the message? You saw the message. You didn't revert to me, so I was not sure. I thought I'd sent it to a wrong number. I included withdrawal of charges so that you don't encroach on the main figure. Yes, that is at a personal level, not the government. There was no budget for the government, but as a person felt it. Of course, the other children need support. The other participants, it was which school and which one? We had around two. The deaf, and then yes, so there are around 3 schools. Yeah, so within my small salary, I'll find for each of those schools 200,000, 200, just. When you give, you receive. It is a blessing to give than to, but so many people among us that have changed it the other way around. It is a blessing to receive than to give. To give, you feel the satisfaction, you feel now you are parents, you feel like you are about to arrive. Indeed, you will arrive. So let us learn to give. So I want to appreciate press tanks. I think they promised to give a water system. What did they say? A tank? A water tank to Nakivubo Blue. Have they left already? Chris Tank, are you still there? They have good. They are up there. Can we clap for them? Thank you so much. So it shows you one thing. If we want to go far, let us support the private sector. You can see the way they are doing it. Without a lot of labor they have given. Corporate social responsibility. Besides that, those are the people who pay taxes. So we must be listening to them and supporting the private sector. They have a key role to play in WASH. We appreciate. You talked about the children's games here. I hope somebody captured the videos. We want to share, even internationally. I'm going to post it. Recently, we had a meeting in New York. They wanted me there, but I couldn't go because of certain challenges. But I want to post, let the UN also see what is happening here. By the way, for your information, in the whole of Africa, Uganda is rated the best in the world in terms of advocacy because we have now this forum in the parliament and we are pushing. So many countries are coming to learn from us and they talk about us in the UN. So forget about just here. We are now on the air. We are now on what? Air. So if you love, you can clap again for air. That is it. We are moving. So of education, I'm happy. We are working it. We are on the right path. We are now waiting to see what will happen with the Ministry of Health. Because for me, those are the key ministries. So education, health, then the next one I expect to say something is gender. Because the software, you know what I mean when I talk of software. The software, not the one of the computer, but the software activities. Yes, dealing with the community. We are talking about mindset change and the like. We need to visit the Prime Minister. Let's organize ourselves. I'll provide the leadership. Go to her boardroom, let us talk with them. Let's speak about WASH. Let's take WASH to government. Because government maybe is delaying to come to us. Let's go to government. Let's take WASH there. So we need to visit her. If we can get the time, we need to link up with the Speaker of Parliament. The stakeholders should converge. We meet with the Speaker. Discuss and WASH. I think that's the way to go. I'm so excited. The participants have been so good. I have seen here, I think, how many did we record this time? The partners who participated. Does anybody have a record? Because I'm seeing here, Crescent, the main participants, the conveners, Ministry of Education, we have Water Aid, Save the Children, Water for People, Water and Life, UNICEF, UPF WASH, and there are so many here. Food for the hungry. Where is food for the hungry? They are not food for the hungry. Where is the food? They are not here. Okay. Action something, evidence action, Plan International, BRAC, Uganda Water and Sanitation Network, Peace, CD, AMREF, IRC, some are hidden. IRC, BRAC, I've seen all this. Sanitation for millions, and then which one have I left out? GIZ, I wish I had gotten the list, but all in all, I wanted to say we are so grateful. Most times we have called for partner support and they don't come. If you go around Kampala and you see most of these events, I think this has to be the best. It's the most attended, with the biggest participation, biggest intention, biggest orientation. All those English. Thank you. I want to appreciate the MCs, the moderators. You've been so beautiful. The controllers of the equipment, the machines, no disappointment from the microphones. Even for us, the poor speakers, our English comes directly. So you have done quite a wonderful job. Yes, the people who have been at the back registering the participants, they have done their part. Thank you so much. They did it so well. Hotel Africana, no disappointment. And then the other note, the band, the brass band yesterday, they did quite well. Yes, the schools. Oh, the branchman is a school. No, I gave them already. You know my speed. I started with them because they had done well. I lost my economic temper. I sent them. If you had yesterday noise coming from up, what you had, TT, that was mobile money from me to them. I did it. Yes, because I knew they were not coming back today. I finished with them. Yes. So the participants have done well. The minister who was here to open yesterday in absentia, appreciate. The First Lady and Minister of Education and Sports in absentia, we appreciate. She gave us that enormous support. And I want to say, because of her name, the attendance has been, because everybody is saying, oh, First Lady is going to be here. So I have to be saying good. So it's good to be near good people and big people. You will eat a lot. Like somebody told us one time, don't stay away from Bank of Uganda. One day they will get confused when they are clearing the boxes. You find a box which has money, they say that is maybe garbage. You get something. So that is Africa for you. We appreciate all the drivers. The drivers have done a big job. Every one of you has been wonderful. In December, we shall be holding the WASH Symposium. This one now is general. So I want to announce from here that all of you should do your best to participate in that one so that we make it the mother of Symposium. Let's make it the big one. And I intend to make it regional now in nature so that we even drag Kenya to be here. Bring Tanzania, bring Rwanda, the new baby Congo, South Sudan, and the rest. If the PS there can come, the minister can come, let's make it regional because we are now in East Africa. That is the way to go. But when we send the request, please send us the money. Support us. Sometimes we write, then some of you don't even reply. Those are bad manners. The Lord Jesus Christ is watching you. He will not be happy. Even when you go and pray on Sunday, he will ignore your prayers because you are not open-hearted. So I thank you so much. I thank my colleagues. They did a great job. Honorable Atuka was meant to be standing for me to close this particular meeting. But by God's grace, I was able to come early. But he had already prepared well. He passed over to me the information. And whatever I said here is what he was going to say. So what I told you was for him. So thank you so much. May God bless you. As we close this meeting, I pray upon you blessings. Those who are not married, get married officially. Those who don't have money, get money officially. Those who don't have wash, let it come and you wash with wash. Yes. Those who have been oppressed, may you get the relief. Those who have been unjustly and unjustly treated, may you get justice. In Jesus' name I've prayed. As we close this occasion for God and my country. Thank you.
Ladies and gentlemen, well done. So right now, it is time for you to remember where you threw your coupon. We would like to go and finalize our day by again continuing to have other discussions with our mouth. We thank everybody for everything that you have done. We have been Nairobi Joyce and thank you again. And
Elizabeth Nakafoni.
One person who was with us is
I'm John Windsor, Chambogo University.
nice to meet you, everybody. Thank you. God bless. Admin issues, Musa.
Thank you very much, our chief guest. School leaders, share your corners with the Honorable Silas. Colleagues, we are moving out without coupons for lunch. And before we move out, I think let's have a group photo. Let's have a group photo as we wind up. Kindly.
For the group photo, we might want to have this in our background, so yes, we'll probably still use this place. Please come and we have our group photo here with our chief guest. And the teachers of those schools, please, can we have those contacts?